Let me say this, nothing has changed about the science of vaccines. We need people not to be preyed upon by demagoguery, and there should not be a politicization of these very issues. Let me go to some of the contradictions that the administration has made as we talk about budgeting. $1 trillion cuts from our healthcare system, putting 440 hospitals at risk so that we can have a tax cut for the wealthiest among us, and that's based on tax distribution tables. That's not made up at this moment. Baseless claims about Tylenol and autism, this damage could be catastrophic. The administration's agenda includes obstacles to better health care. Costs are sky high, but that has much to do right now with a lot of issues, including tariffs in Iran. We want to push healthy eating for everybody, and I've not met any candidate anywhere who ever said, vote for me, I'm for more fraud. That doesn't happen. We want a fair and balanced approach to looking at it. A proposed cut of 12.5% to HHS. Let me remind all in this room, and you're going to be familiar with this name, Mr. Secretary, Silvio Conti. He was the Republican member of Congress in the district next to mine. He was the author of the LIHEAP program, and it has worked beyond any objective measurement that we believed at the time. He wanted to make sure that people had an opportunity in the climate of New England to heat their homes during the winter. 159,000 families in Massachusetts relied upon LIHEAP last year. Attacking child care providers and delaying their payments means more parents will choose between the child care and their paycheck. Families see through podcasts and campaigns. 60% of the American family worries right now about affording health care. We should be fixing and repairing the parts of the health care system that we want to improve for all members of the American family. We should not be offering just to deflect blame. We should be pointing out this achievement. People should not have to choose between medicine and child care. We delivered historic relief with Medicare negotiations. We capped out-of-pocket costs and we lowered premiums. We need to come to the aid of the American family at this very difficult time. Republicans need to understand that Americans deserve a fair shake. I'm going to close on the note that I opened with, and Mr. Secretary, I think you're well aware of it. What we built in Massachusetts over these years since Senator Kennedy became president, it was done with Republicans and Democrats, but together we're immensely proud of what it was that we achieved, and we don't want to see it dismantled. Thank you, Mr. Chairman.
Thank you, Ranking Member Neal. Today's sole witness is the Secretary of Health and Human Services, Robert F. Kennedy, Jr. The committee has received your written testimony, and it will be made part of the formal hearing record. Secretary Kennedy, you have 5 minutes to deliver your remarks, and you may begin when you're ready.
Now? All right. Thank you, Mr. Chairman, Ranking Member Neal. Members of the committee, thank you for the opportunity to appear before you today to discuss the President's fiscal year 2027 budget request. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policy, captured agencies, and profit-driven systems have caused it. Parents across the country demanded change, and we are delivering it. We are ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of Americans first. President Trump and I are challenging the status quo and the institutions that defend it as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated most favored nation drug prices with 16 of the largest pharmaceutical companies, so Americans no longer pay more than other people in wealthy countries for the same medications. We're bringing real transparency to healthcare pricing so patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table to reform prior authorization. We are cutting red tape, speeding decisions, and demanding transparency. We are also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to the American people: eat real food. HHS has also opened the door to partnerships with industry, trade associations, nonprofits, and advocacy organizations. More than 50 medical schools have committed to expand nutrition education from an average of just 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry is committed to phase out petroleum-based dyes by year end, and many have already eliminated them. In conjunction with these efforts, FDA approved 6 natural food colorings derived from fruits and vegetables. Though President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families and driving faster access to life-saving treatments. We're restoring gold standard science and integrity across the agency. We're protecting children from sex-rejecting procedures that expose them to irreversible harm. We're eliminating outdated and misleading warning labels on hormone therapies used to treat women during menopause. We're strengthening oversight of organ procurement. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. We're applying the same focus and urgency, as you mentioned, to rural America. The Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history, $50 billion over 5 years to strengthen hospitals and ensure Americans can access the care they need no matter where they live. Members of Congress on both sides of the aisle have made rural health a clear priority in their conversations with me, because every state is feeling the strain of hospital closures, workforce shortages, and gaps in access. HHS announced more than $135 million investment this month to expand rural residency programs and nutrition services. The data is clear. When physicians train in rural communities, they're more likely to practice there. The President's budget puts all these priorities in action. It invests in prevention because preventing disease costs less and delivers better outcomes than treating it. As my uncle, President John F. Kennedy, said, progress is a nice word, but change is its motivator, and change has its enemies. We see those forces clearly: entrenched interests, defenders of a failing status quo, and institutions that put profits ahead of the American people. That resistance underscores the urgency of this moment. We can reverse the chronic disease, improve public health, and lower costs. I stand ready to work with this committee and Congress to seize this opportunity, to implement and codify lasting generational reform in American health care. For our country, for our children, and for the health of the American people, together we can make America healthy again. Thank you very much.
Thank you. Without objection, each member will be recognized for 4 minutes to accommodate the Secretary's time. As always, we want to ensure that all members have an opportunity to ask questions of the Secretary. We'll now proceed to the question and answer session. Start with Mr. Buchanan.
Thank you, Mr. Chairman, and I want to thank Secretary Kennedy and your leadership. It's been incredible in my mindset. The U.S. is spending $5.3 trillion on health care and getting sicker as a nation. 6 in 10 Americans, 95%, in terms of Medicare beneficiaries, have at least one chronic disease. Roughly half of the adult population is projected to be obese by the end of this decade. I believe this problem stems from unhealthy and ultra-processed foods, and I applaud HHS and its continued support and leadership on this issue. We must prioritize prevention as the key to reversing trends in heart disease, obesity, and diabetics. I believe the best way to do that is bend the cost curve, is by making sure that people don't get sick in the first place. I like to say to people who are, you need to be the CEO, I read it, of your own health, and I think that's critical. Mr. Secretary, I appreciate our strong partnership in advancing the health of this country. I look forward to continuing to work together to support a healthcare system that values prevention, not reaction. My couple of questions I've got together, we've accomplished so many things to support health and prevention. For example, we've worked on new food pyramid, is real food, cutting the ultra-processed foods. We're also brought back the presidential fitness guides, which I'm excited about. And I guess in terms of what some of the things that we've done, what do you think we could be doing more of in that space in terms of diet and exercise?
Flipping the food pyramid and issuing new dietary guidelines was the beginning. When I came into office, I was handed the dietary guidelines that have been developed by the Biden administration. They were 453 pages long. They were incomprehensible. They were written by food industry lobbyists, and they reflected the mercantile impulses that had driven Fruit Loops to the top of the food pyramid. Fruit Loops isn't even a food, it's just poison. And we brought together the best nutritionists in this country from the best universities all over this country, a dozen of them, who worked 11 months to reform the dietary guidelines and offer for the first time not dogma-based guidelines, but science-based guidelines. Every recommendation is cited and sourced in multiple peer-reviewed publications. That's the beginning. The next part, we have to drive those changes into dietary culture in our country. We are aggressively using the food subsidies program with Brooke Rollins, my partner in this.
Let me mention, I've got another question with 1 minute left, but I'm deeply passionate about promoting access to screening as a way to prevent diseases. Through my personal experience with Alzheimer's and lung cancer, I've become a strong believer in the power of detection and prevention, and I'd like to get just your thoughts and ideas on that in terms of screening, like lung screening for cancer and stuff like that.
Screening for prevention is absolutely critical. We are reforming now the USPSD, which is the committee that decides on new procedures and interventions that need to get CMS compensation. And that committee has been lackadaisical and negligent for 20 years. We're now bringing new members on who have a clear mission. We're going to have much more frequent meetings. We're going to have, for the first time, transparency. We're making huge investments at NIH and elsewhere in doing the kind of science that we need to do better screening for Alzheimer's.
Thank you, and I yield back.
Thank you, Mr. Neal.
Thank you, Chairman. Mr. Secretary, fighting fraud is bipartisan here. As I noted earlier in my remarks, that nobody ever campaigned with a bumper sticker that said, vote for me, I'm for more fraud. So fighting fraud certainly has considerable support across this Congress, and nothing makes me or you or others in this room madder than those who might rip off Medicare. So I think those who commit fraud ought to be held accountable. So let's talk about Lawrence Duran. He perpetrated what at the time was the largest therapy issue-related Medicare fraud in history, hundreds of thousands of false claims. He was sentenced to 50 years in prison, and he and other collaborators were ordered to pay back $87 million in restitution. His sentence was commuted by the president. Did the president consult you as we pursue this fraud?
I don't know anything about that case.
Fair enough.
Congressman, I can say this. This has not been, although it's a bipartisan issue and there's bipartisan passion for this issue, the application, the implementation of anti-fraud has not been bipartisan.
So let me go to the next one, Mr. Secretary. How about Joseph Schwartz? He pled guilty last year to bilking taxpayers out of more than $38 million, paid himself millions of dollars along the way. His negligence as it related to nursing homes is well known to all of us. President Trump pardoned Mr. Schwartz. I'm assuming he didn't consult you on that either. If we're going to talk about fraud, it's not the people just at the lower end of the economic scale. If we're going to pursue fraudsters, it's not just the people who might make simple, honest mistakes that could be corrected. It's the people at the top that help to perpetuate this fraud. And the administration's position seems to be that it's only the recipients and not the providers that can commit fraud. We are not defending fraud. We're not cheering for it. We're not excusing it. But there needs to be an even-handed approach, including not passing out pardons to people that might be supporters of the administration. So let me, on a nice note, thank your staff here in front of all for helping me out recently, or helping my constituents out, on an issue that related to daycare. Your staff came to the aid of a Head Start provider in my district and really helped out 100 families. The problem is that we don't want that to be something that can be completed by senior members of the Ways and Means Committee coupled with a group of administrators who know the problem and have come to the assistance of those who need it. But it shouldn't be that way. It needs to be more universal, and the cuts that are being proposed to these initiatives are not helpful to the American family. I look at these decisions, and if we're going to pursue fraud, Mr. Secretary, it has to be across the board. And we want an even-handed approach to these fraud investigations, including those whose schemes have cost the American taxpayers hundreds of millions of dollars. I yield back my time.
Mr. Smith.
Thank you, Mr. Chairman. Thank you, Secretary, for being here this morning and entertaining our questions. I represent one of the largest land area districts in the country, and most of my constituents live in rural and even remote areas. Agriculture is the engine of our economy in my district, and we're proud of our role in feeding not just America, but the world. Now, before I get to my questions, I would like to stress the importance of modern agriculture practices in producing a healthy, affordable, and sustainable food supply. The agriculture industry depends on our standards and regulations being science-driven and risk-based. I do want to say that threatening the availability of technologies could inadvertently lower yields and actually increase the price of food at a time when many Americans are already struggling to make ends meet. So I encourage you to continue to bring farmers and ranchers to the table as you consider matters relating to agriculture. Moving on, I do want to talk about rural health. You mentioned the Rural Health Transformation Program. I think that means a lot to so many of our constituents, our communities, our states. The RHT programs notice a funding opportunity to recognize the important role of pharmacists in meeting rural communities' health needs. I believe that pharmacists are an underutilized part of our health system. Nearly 9 in 10 Americans live within 5 miles of a pharmacy, making pharmacists among the most accessible health professionals. Because of the broad accessibility, I think there is more we should do to empower pharmacists to help meet rural health needs. That's why I introduced a bill we call ECAPS that would improve access to care for seniors across America by providing Medicare coverage of pharmacist-administered tests and treatment for common illnesses like COVID, flu, and strep. By allowing pharmacists to test and treat seniors for common illnesses, we can make these services more accessible and reduce pressure on emergency departments. I do want to ask, what is your approach to improving access to healthcare services for Americans who live in rural and remote areas, and what can we do to ensure Americans in rural areas aren't left behind in our healthcare system?
I mean, last week I went to Arizona to announce an unprecedented $125 million investment in community health centers, which are serving 39 million Americans, mainly in rural areas around the country, to improve nutrition and also retention of their workforce, which is one of the reasons that so many of our rural health programs, so many parts of it are failing today. We've seen closures of 120 rural hospitals since 2010. It is a crisis when these hospitals close. It doesn't just deny access to health care. Those hospitals are economic drivers for their community. They're the highest paid jobs. They're oftentimes the biggest employer. For that reason, President Trump made the biggest investment in rural health care in American history, a $50 billion Rural Health Transformation Fund. Right now, Medicaid gives about 7% of its money to rural hospitals, and it's about $20 million a year. Well, we're increasing the flow of federal dollars to rural community health care. by an extra $10 million a year. So that's a 50% rise over the next 5 years. And it's going to give those hospitals the ability to upgrade their infrastructure, to install telehealth, to move to AI, and to retain workers and do all the other things they need to achieve permanent stability.
I appreciate that. And just in closing, and I just want to note, moving to CMMI, Center for Innovation, I appreciate its intent. I do believe it lacks some transparency, and especially when CBO found CMMI's activities increased direct spending by $5.4 billion. So my time has expired, but I would encourage you to take a look at that so that we can make sure that innovation drives cost savings and better outcomes rather than just driving more spending and not positive results. Thank you.
CMMI has been disastrously mismanaged in the past. We are changing that. We're making it a center for innovation that Congress intended it to be.
Thank you.
Mr. Doggett.
Mr. Secretary, since waste, fraud, and abuse has been something of a watchword in this administration, I'm sure that you're familiar with the December 3rd Government Accountability Office response to a request by Chairman Smith, which reported significant agent and broker fraud with the Affordable Care Act, including brokers signing up people who didn't even know they were signed up. As you're aware, last May, under your authority, CMS fully reinstated all 850 brokers and agents who had been suspended back in 2024 because of suspected ACA fraud. Can you guarantee to our committee today that every one of those suspected brokers and agents was thoroughly investigated and found to be innocent of any fraud, any wrongdoing, or criminal activity?
I can tell you.
Can you, sir? Yes or no? You can't answer that. That is very troubling, I must say. 850 people accused of fraud, suddenly reinstated all at once. Do you know whether any of these suspected fraudsters who were reinstated so swiftly were subject to any additional oversight under your authority? Have there been guardrails that have been put in place to ensure those 850 agents don't continue to commit fraud?
Congressman, I'm a lifelong Democrat, so I was shocked.
I don't care your party affiliation. We're all against fraud, sir.
I was shocked when I came into this agency.
Were you shocked to see that 850 people who were suspended for fraud had been reinstated all at once?
I was shocked to learn that President Biden had directed my agency to stop all program integrity activities and focus on enrollment.
Taking back my time, sir.
And that's what caused the problem that you're talking about.
President Biden's administration was the one that suspended 850 suspected fraudsters. Your administration was the one that let them all go back to work. Have any of them
President Biden fired everybody in my agency except for 6 people who were involved in program integrity.
In fact, under your leadership, you have suspended the very people at CMS who are responsible for overseeing any fraud in the program.
But we've done more to combat fraud than any administration.
If you want to filibuster, go to the Senate. But would you please try to answer my question, sir? Have there been any new complaints against these 850 brokers?
As I said, I'm happy to talk to get my staff to contact
I'm not asking if
staff.
you're happy to talk. I just want to know the answer to my question. Have there been any new complaints of fraud against these people?
I don't know why those people were reinstated. For as far as I'm concerned, it may be because of a lawsuit. I have to check on that.
Well, I wish
I
you would.
can guarantee you there is
Thank you,
no
sir.
administration
Reclaiming my
history.
time, sir, as it runs out. It is very troubling that the only fraud that Chairman Smith referred to as a smoking gun to deny affordable health care credits, put the blame on the mother that was trying to protect the sick child, that nothing was done about that, and the Secretary still doesn't know much of anything about it. As far as fraud, Paul Wazak is one who had $10 million of wages that he kept, some of to buy a $2 million yacht. His mother contributed to the Trump campaign, and he no longer has to pay $4.4 million or stay in prison. Mr. Secretary, I want to know what role you play in the soft-on-crime approach to healthcare fraudsters. Have you recommended that any of these healthcare fraudsters should get pardons or commutations, or did the campaign contributions speak for themselves?
I don't think there's anybody in this country. I don't think there's anybody in this country who believes that this administration is soft on fraud. We're the first
Just
administration
the
in history.
fraudsters
We're
who
going
have
after
the money
fraud
in the
every
cottage
state.
industry to get themselves pardoned and not even have to restitute what they've taken from those they've defrauded. It's really a disgrace.
It's
I'm
just
surprised
not-
you would defend it.
It's not a credible story.
It's a fact,
look
sir. It's not a story. It's a fact.
Mr. Kelly,
More fraudsters pardoned than
time
any
has
president in
expired.
American history.
your time has expired,
Thank
Mr.
you.
Doggett. Mr. Kelly.
Thank you, Chairman. Mr. Secretary, thanks for being with us today. And as usual, the beatings will continue till our morale improves. I did want to just talk about one thing real quickly. I'm really wishing you success in the rollouts of the bridge and balance models, expanding seniors' access to weight loss drugs. And as Mr. Buchanan talked about this is really critical. But at this point in today's hearing, I'm going to turn my time over to Mr. Swikert from Arizona. I think he has would take more than 4 minutes for him to go through all the things he wants to ask you. But again, thank you for walking out of where you were into this. I appreciate what you're doing, and your family has always been a hallmark of American service. So thank you so much, Mr. Secretary. Mr. Swikert.
Thank you, Mr. Kelly. And I appreciate him doing this. And well, let's actually do some waste and fraud where we have real money. I actually want to talk about what's often referred to as CPAP, the CDPAP, New York Health. Let's actually use New York because that's actually what us in Oversight have been looking at. Something is wrong when the biggest job creator in New York City over the last few years turns out to be a home visitation program that you all manage. We have some data here that basically says for every 1,000 residents 65 and up in New York State, the whole state, 171 are receiving these stipends, these payments. In New York, if New York itself was actually at the Medicaid population average, it would save $43 billion a year. When we start to actually examine and dive into the numbers, the disproportionate, yes, we have frauds here, frauds there, but we have entire states that seem to be helping this fraud along. What do I do to help a program like this that substantially expanded during COVID, that we now have not only New York, but a handful of other states that seem to be using it as a jobs program and not a health program?
Senator, that is a huge problem. New York State pays on average 80% more per capita on Medicaid than any other state. 80% over the average. And part of the reason for that, as you point out, are these waiver programs that the states, many of the states have now applied for and received. In the old days, Medicaid paid for medical procedures. So if you got a hernia operation, we could figure that out at CMS. We could see you had a scar. It was done by a licensed doctor, by a licensed nurse, and we could track to make sure it actually happened. The waivers allow people, family members, who are taking care of an elderly parent to get paid for balancing the checkbook, for picking up the groceries, for driving somebody to a doctor's appointment. Today, the biggest job in New York, 650,000 people, the biggest employment niche is home care. These are family members who are getting paid to do things that they used to do as family members for free. And this is rife with fraud because we have no way at CMS to determine whether they actually perform that duty or not. We don't know whether you drove your grandmother to a doctor's office. So it's an opportunity for fraud, and states corrupt people, fraudsters are taking that opportunity all over the country. And it's one of the reasons that Medicaid doubled during the Biden administration, because we are paying for fraud now as much as for medicine.
Thank you, Mr. Secretary. And we get a round two. I yield back.
Mr. Thompson.
Thank you, Mr. Chairman, and thank you for your persistence in getting this hearing scheduled. And Mr. Secretary, thank you for finally appearing before our committee. Mr. Secretary, let's start with an easy one. Do you have a medical or public health degree?
No,
No?
no.
Yet you're overruling doctors, scientists, and public health experts across our country. Your dangerous conspiracy theories are undermining safe and effective vaccines. Mr. Secretary, I want to echo my friend, the ranking member's comments about polio. I remember as a kid, kids older than me in school with me who got polio. They live with the lasting impacts of that infection for the rest of their lives. I was fortunate to get the polio vaccine, and I was fortunate to never get polio because of that vaccine. And because we're about the same age, I'm sure you have similar experiences. But now you undermine vaccines and are helping make diseases deadly again. Mr. Chairman, I ask unanimous consent to submit for the record this article from the Sacramento Bee about the rising measles cases in California.
Without objection.
Thank you. In 2000, measles were declared eliminated in the United States. And I've got a graph behind me that shows that. Under 4 years of President Biden, there were 514 measles cases in the U.S. Under just 1 year of President Trump, there are nearly 2,300 cases. Mr. Secretary, kids have died because measles is running rampant under your watch, in large part because President Trump allowed your conspiracy theories to run our public health. Americans need serious leadership grounded in evidence and science. Instead, we have you and this president elevating misinformation and undermining basic public health. HHS should be led by professionals who respect science and data, listen to doctors, and put patients first, not by rhetoric, not by conspiracy, and not by ignoring established medical facts. So today, Mr. Secretary, this is not just about policy differences. It's about whether this department is going to protect the health of the American people or put them at greater risk. Right now, it looks like the latter. Let's not sugarcoat this. Americans are paying more for health care, not less. Families are being squeezed at every turn, and instead of relief, they're being handed policies that will make things much worse. You and this administration promised to lower costs. Instead, costs are rising. And you and this administration ripped health care away from millions of people. H.R. 1, the big, ugly, big, beautiful bill, whatever it's being called these days, cut $1 trillion from Medicaid. That means fewer doctor visits, delayed care, and more people showing up in already overcrowded emergency rooms. Let's be honest where this leads. People will get sicker, preventable conditions will go untreated, and people will die. Mr. Secretary, you shouldn't be in this office. I yield back the balance of my time.
Mr. Schweikert.
Mr. Secretary, you are actually the first person I've had in my 16 years who's actually willing to have conversations with me on how to have the revolution of lowering the costs of health care and help our brothers and sisters be healthy. But I want to go to one that makes the lobbyist community pucker up because every other lobbyist seems to be working on this. These are just some of the MedPAC reports. You pay for them. They basically say Medicare Advantage, Medicare Part C, has a misalignment on the math. We need to come to a final conclusion. Are these accurate? Or the stories I get from the lobbyists accurate? Are the insurance companies accurate? Because the latest report says Medicare Advantage comes in at 114% of fee-for-service. In 2005, when we set up Medicare Advantage, which I'm a big supporter of, a capitated model where you make your profit by helping your brothers and sisters be healthier, instead of a model where you make your money by constantly risk scoring them as sicker. And you saw last year's Wall Street Journal series showing how many people had been scored as being sick, and they didn't have that disease. They had never been tested for that disease. 114% compared to 95% fee-for-service is about $1.75 trillion over 10 years, making it the single biggest misalignment in the federal government. Can I beg of you, and I know you're going to, Dr. Oz and others, we need to put everyone in a room, maybe our actuaries, maybe my economists from the Joint Economic Committee who've been working on this for 3 years. It's a stunning amount of money. How do we use Medicare Advantage, a managed care model, to have your vision of they make a profit because you helped people be healthier? It may require a multiple year enrollment, so there's a payoff for the investment. 31% of Medicare spending is diabetes. What can I do to work with you? What can I do to move CMS and HHS to a vision here of healthcare for seniors?
Thank you, Congressman. I'd love to have those discussions with you. I'll say the fraud, a part of it is perverse incentives, as you pointed out, and part of it is fraud. Medicare Advantage was created as to end perverse incentives to give us value-based care, as opposed to traditional Medicare. And in some ways, it's doing that. In every metric that we look at, people who have Medicare Advantage are better off. They're healthier, they're getting treated better, they're more compliant. And people who are getting cost or fee-for-cost programs. One of the other problems is that one of the major problems is upcoding. And it's just rampant fraud throughout the system, as you point out, and we are fixing that now for the first time. And I can tell you that we're already seeing some change in the discrepancy. This year, we raised the premiums for, or we're proposing to raise the premiums for Medicare Advantage by 2%, whereas Medicaid and Medicare are going up by 5%.
Mr. Secretary, I want to propose a more radical solution of alignment of incentives. Get rid of the risk scoring. I would get rid of the star rating and do those scoring at the beginning, and then design a system where as you help the enrollee get healthier, they benefit. We're almost out of time. I want to thank you and the agency for also starting the things of wearables, the thing you wear in your wrist, the thing you wear, and the ability to allow Americans to sort of have their own medical lab attached to them. Now we have to figure out how to allow it to prescribe. And with that, I yield back to Mr. Chairman.
Mr. Larson.
Well, thank you, Mr. Chairman, and Mr. Secretary, welcome to the Ways and Means Committee. I want to first associate myself with the remarks of Leader Neal, especially as it relates to the great legacy of your family.
Thank you.
There wasn't, on my paper route, there wasn't a house whose door I didn't knock on where there was a picture of Pope John the 23rd and John F. Kennedy. That's how deep and incredible influence that the President of the United States, the first Catholic elected, had on generations of people, and still every bit as much relevant today as he was in the 1960s. Your family and its legacy of public service deserves always to be acknowledged for the enormous sacrifice and their willingness to serve, and to serve in the public interest. Well, Mr. Neal also pointed out, as my other colleagues, I think you can understand and appreciate the incredible frustration. President Kennedy said that science is the quiet power. And whether it comes to sending a man to the moon or vaccinations, President Kennedy was out front in terms of his belief in government and his belief in making sure that vaccines were provided for the health and well-being of the American people and the children we're all sworn to serve and protect. I would like, Mr. Chairman, if you would, to submit for the record the Connecticut Department of Public Health testimony on the establishment of vaccine standards.
Without objection.
Thank you, Mr. Chairman. I would also, Mr. Chairman, like to submit for the record a stark divide. Americans more confident in career scientists at the U.S. health agencies than leaders.
Without objection.
And I guess that's what it all comes down to. When we look at the vaccination process, and I think everybody's entitled to their opinions and views, but we're not entitled to our own facts. And the facts, I think, speak clearly on this. When I confront doctors in my community, they say they're spending more time counseling people about taking their vaccination shots. We know what we were able to do. Just 4 years ago, the state of Connecticut braced for what they thought might be an outbreak of measles because a case was reported. But as it turns out, that was the only case. And it was attributed to the fact that people were vaccinated, and that's what prevented that. And as Mr. Neal and others have mentioned, whether it's polio, whether it's measles, whatever the case may be, I think you can appreciate how deeply concerned people are about this and how the contrast between what your uncle and the President of the United States said in his beliefs and yours with respect to vaccinations. And with that, I see my time has run out. I'll yield back my time.
Thank you. Mr. LaHood.
Thank you, Mr. Chairman. Mr. Secretary, welcome. I want to get your opinion on the FDA. There's been broad reporting in the press on concerns that and mismanagement and bungled drug reviews at the FDA have chilled investments in life-saving innovative cures, and that China is rapidly becoming the recipient of those investment dollars. I also serve on the Select Committee on China. And as we look at how do we win the strategic competition when it comes to investment and innovation, it's very important that we have a vibrant, efficient FDA. And I understand that you aren't involved in those drug review decisions, and I intend to take that up with Dr. Markey. But it seems like a squandered opportunity to maintain America's position as the premier destination for investment in medicine and modern technology. Can you comment on that, Secretary?
What I would comment is I acknowledge that Congress is eating our lunch, and that happened during the Biden administration. We are redressing that. We have broken every record for drug approvals. We approved 67 drugs. This year, new drugs. We approved, which is a record. We approved 39 new devices, which is a record. We approved 91 new generic drugs, which is a record. We are 100% online to make all of our PDUFA deadlines, which does not usually happen. We have dramatically shortened the period from approval from conception to commerce. We just approved 2 new drugs, 2 new oncology drugs in record time, one in 45 days. The closest before that was 310 days. The other in 55 days. These are 2 drugs that are so effective that they can bring people out of hospice. So we've moved to 2-to-1, from 2-to-1 trials to 1-to-1 trials where it's appropriate. We're using AI to dramatically shorten the times to approval. We're doing things that no other agency has with greater competence, greater efficiency than any other agency in history. You hear these stories about a drug that's been refused. You read about them in the Wall Street Journal. This week they were talking about a melanoma drug. Every Every panel within FDA, all the career panels, the career scientists who looked at that drug said it was not effective. The drug maker was told to do a 2-arm trial. He did a 1-arm trial. And all the people who were tested also received a chemotherapy drug, so we don't know what the effect was. And Marty made the correct decision to not approve that drug, but everybody goes after him because the industry is so powerful. They own Congress, they own the media, and they can beat up Marty McCary because he's trying to do change over there.
Gotcha. I want to switch subjects. I'm also the chair of the Work and Welfare Subcommittee, which has jurisdiction over foster care and the SHAFE programs. Yesterday, we had the First Lady here to talk about Fostering the Future, her initiative when it comes to foster care. Can you comment on the role HHS is playing in implementing the Fostering the Future executive order to help improve outcomes for foster youth?
President Trump and the First Lady, who has been extraordinary for us to work with, have said their vision is one family for one child. Right now, we have a 2-to-1 ratio. And part of the reason for that is that the Biden administration was excluding an entire class of people because of their religious beliefs. We are, and told the states to actually pass laws, instructed them to pass laws, refusing families who had certain religious beliefs, mainly Christian religious beliefs, to not be allowed to have children. And that dramatically constricted the pool of available parents. We are changing that. We're also addressing one of the big issues, which is to allow children to stay with their families of origin. One of the biggest drivers of those separations is drug abuse. And we are aggressively going after these issues. And partially as a result of our work, the number of foster children has dropped from 425,000 to 325,000 because there's more kids who we're doing our early preventative services on and intervening early with parents who have drug addiction problems.
Thank you, Mr.
All right.
Secretary. I yield back.
Mr. Davis.
Thank you, Mr. Chairman. Secretary Kennedy, thank you, and I too share the admiration of your family's legacy and contributions to the development of this nation. In my district in Chicago, though, child care can be hard to find. And when parents can't find child care, they can't go to work. Last week, President Trump said, and I quote, "The United States can't take care of daycare because we're fighting wars and need to spend our money on those." Do you agree with President Trump that we should cut child care to pay for his war in Iran?
I don't think that that's what President Trump meant, Congressman, and I appreciate you very much for actually giving me an opportunity to answer your question, which none of your colleagues have done. They've all shut me up, and they've talked about science, but science is about debate. They give a little speech that they can go and market, for fundraising, and then they don't allow me to answer the question, and I deeply appreciate the respect that you've shown.
Well,
In this
thank you.
budget, we were told to make a 12% cut across our department because Congress wrote a $39 trillion debt. We're now having to tighten our belt. The
me
two
move
programs
on.
that I
Secretary.
protected and that Russ Float protected were the Head Start program.
Okay.
Oh, it is getting no cuts. And
I've got
incidentally,
another-
there have been no cuts to Medicaid.
I've
Look at
got
the
another
CBO.
question that I need to ask. Black women are nearly 3 times as likely to die from pregnancy-related causes as white women. Yet the Trump administration is undermining black maternal health from all sides. The GOP slashed over $1 trillion from Medicaid, which pays for over 40% of births in the United States. President Trump just proposed cutting maternal and child health programs by over $800 million. DOGE canceled funds for several research projects that could save countless black mothers, like the Morehouse School of Medicine research on improving the health of Black pregnant and postpartum women? How can we lower Black maternal health experiences if we're cutting funds for these critical programs? And the administration says that you can't consider race or ethnicity in healthcare.
We are this administration, under my leadership and President Trump's leadership, is doing more to advance maternal health than any other administration in history. There was tremendous duplication of departments. We had 42 different maternal health services in our department, and we cut some of those and consolidated them. Right now, we are investing huge amounts of money in maternal health. We serve 59 million American mothers. Our perinatal program, which is a groundbreaking program, we're now in 220 hospitals,
Well, thank you.
has reduced maternal mortality in those hospitals by 42%.
My time
Nobody's
is
done
going
that in
to-
history.
My time is going to expire, but let me ask you, the community health centers are excellent stewards for the 340B program, and they've done a great job with them. Now they're burdened with a new model and reporting requirements. Would you consider exempting the health centers from that model of rebate, all of the reporting things that are making it difficult?
I'm happy to talk to you about that. I can say that we are increasing the budget for community health services centers in this country, in this budget, where everything else is getting cut, because we understand that they do a better job at treating their patients, and particularly patients in poor community, than any other system in our country. And I just gave another $143 million to them last week, in addition to the proposed increase in their budget that are in this budget, proposed budget.
Thank you, Mr. Chairman. Now you're back.
Thank you. Mr. Estes.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for being here today. You know, I want to start by commending the Department of Health and Human Services for establishing the MAHA Commission and an Administration for a Healthy America to fight chronic disease and promote healthy living for all Americans. As mentioned earlier, the statistics are staggering that 6 in 10 Americans have at least one chronic disease, and that 90% of our healthcare spending is dedicated to fighting these conditions. We've got to look at ways to reverse this trend and focus on how do we improve wellness. We're strongly supportive of a pivot away from this reactionary sick care towards the preventive maintenance and strategic alignments for particularly rural health. We also need to recognize the importance of patients' access to quality care and availability of providers. A bold vision for a healthy America doesn't work if we can't succeed to support our rural communities with the essential medical workforce and emergency transportation required. In my district in South Central Kansas, institutions like the Kansas College of Osteopathic Medicine and the future Wichita Biomedical Campus are working hard to generate the next generation of doctors that will be supportive for us. You know, Mr. Secretary, air ambulances are an essential lifeline in rural America, and when emergency happens, sometimes those helicopters are often the only way a patient gets to a medical treatment in time. Many of our bases are at risk of closing because of the Medicare reimbursement rates haven't been meaningfully updated for a couple of decades. And part of that's because the federal government hasn't been doing its job. 5 years ago, the No Surprises Act was required the Department of HHS and Department of Transportation to collect those cost and operational data. And to date, those rules haven't been finalized. And I wanted to just ask, you know, how can we work together? How can we get HHS and Department of Transportation to work to update that?
I am happy to work with you on that. I can tell you that the No Surprises Act was passed with the best intentions, and it was a great law, but it was not implemented by the Biden administration. And those proposed regulations on the No Surprises Act were left to languish. We are now in the final process of finalizing them. And I'm happy to work with your office to talk about the air ambulance problem. And this is a huge issue, particularly in Alaska. So I hear from them all the time about the same issue. And but we've also found a lot of fraud in that area, so we need the kind of audits that you're talking about and then the kind of information that you're talking about. We're really interested in that, and I look forward to working with you on it.
Great. Well, thank you. And, you know, one of the things we're also concerned about is the real threat of retirement of so many providers in the physician workforce. And, you know, as we look particularly of how that's going to impact patients, particularly in rural communities, many of the communities lack specialists, and particularly with the number of physicians at an older age in our rural communities. And we're seeing now more patients are approximately seeing 50% more specialists than in year 2000. And so I wanted to see if there's things that you're doing in the administration to help ensure that our rural patients can get access to some of these specialty care.
I think one of the most important things that we've done to address that very, very grave problem is the site neutrality rules, which we have recently finalized, and that will end the disparity between what's paid to rural providers and what's paid to urban providers, and hopefully dampen the appetite for consolidations, which are destroying rural economies and rural health care, and allow them to get a living wage, which they don't have right now.
Right. Well, thank you. Thank you for all your hard work. I yield back.
Ms. Sanchez.
Thank you, Secretary Kennedy. We appreciate your appearance here today. To win the support of skeptical senators during your confirmation hearings, you claimed, and I'm quoting here, "I support vaccines. I support the childhood vaccine schedule." I was skeptical about those comments because prior to your nomination, you espoused numerous disproven theories that childhood vaccines, including the measles vaccines, were linked to autism, death, and other adverse effects. Not surprisingly, we were right to be skeptical of your promise to support the childhood vaccine schedule because at your direction, the CDC removed its universal vaccine recommendations for children, covering 7 immunizations, including things like flu, COVID, hepatitis A, hepatitis V, and rotavirus. On Fox News last year, you stated, and I'm quoting you again here, "There are adverse effects from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes." A deadly measles outbreak in Texas killed an unvaccinated 6-year-old, the first such death in a decade. So simple yes or no question. It's not that we don't want to let you answer, it's that we all have limited time, and you have plenty of time to answer questions, and you had plenty of time to give testimony at the beginning. So simple yes or no answer will do here. Do you agree with the majority of doctors that the measles vaccine could have saved that child's life in Texas?
It's possible, certainly.
Okay, thank you. I want to look at some very important data. In 2024, under the Biden administration, which apparently seems to be responsible for every ill in the world, in 2024, under the Biden administration, there were 258 cases of measles. And in 2025, under your leadership at HHS, it ballooned to over 2,000. That's a 675% increase. And we are now on track to surpass that this year with over 1,600 confirmed cases in just 3.5 months. If we project those numbers out for all of 2026, we can expect a whopping 6,400 cases of measles. That's a 2,380% increase in a preventable disease. CDC data also shows that about 80% of children who died from flu this season were not vaccinated. The anti-vaccine rhetoric you ran on and the anti-vaccine actions you have taken over the last year clearly correlates with the dramatic increases, again, in preventable diseases. As a mother, this horrifies me. Stopping the spread of communicable diseases is one of HHS's primary responsibilities, and a strong public health messaging campaign on the importance of vaccines could have stopped this surge of measles cases as it had in past outbreaks. But I was appalled to learn that the CDC suspended public health messaging on vaccines last February. It ended a successful flu vaccine campaign as well. My question is, did President Trump approve your decision to end CDC's pro-vaccine public messaging campaign?
You've got a lot of misinformation there, first
No,
of all.
I'm asking you a question. I
Let me
appreciate a
respond
response
to the
the question.
misstatements that you've made.
No, you have other opportunities. I have limited time.
I only have,
Please
you're
answer my
the only
question.
opportunity I have to
Did President Trump approve
respond.
your decision to end CDC's pro-vaccine public messaging
Allow me to respond to a lot of the misinformation.
No,
that
answer
you
my
just-
question, please, sir. I have limited time.
There's a global measles epidemic. We've done better in preventing
There's
it than
no,
any country
there
in
is
the world.
no country that has seen a bigger percentage increase.
That's not
than
true.
this country.
Mexico has 3 times our measles, and they have 1/8 of our
Did President Trump approve
population.
your decision to end the CDC's pro-vaccine public messaging
Canada
campaign?
has double
Was
the
that a
measles, and
decision
they
that
have
was made
1/3
by
of
Trump?
1/8 of our
Did
population.
he approve that?
We've
And
done better at preventing measles than any country in the
Did
world.
President Trump approve your decision to end the CDC's pro-vaccine public messaging campaign?
We've done better at preventing
That's
measles.
not answering my question,
and ending
sir.
the epidemic
That is
than
not
any
answering my
country
question. And I
in the
think you don't
world.
want to answer the question because I think you know
I want to
that
respond to
you
your
are making
misinformation.
terrible decisions that impact very, very real lives, especially the lives of children. Now, one thing that I find incredible is that you suspended this pro-vaccine messaging campaign, but somehow you're spending taxpayer dollars to drink milk shirtless in a hot tub with Kid Rock. And somehow you think that's a better public health message
Your time has
than
expired
informing
by a
the
minute.
public about the importance of vaccines?
Gentlelady's
Really?
time has expired.
Really? I yield back.
You don't have anything to yield. Mr. Smucker.
Thank you, Mr. Chairman. Thank you, Secretary, for being here today. I'd like to first thank you for your work. Thank you for your willingness to do this. Thank you for your courage, because taking on entrenched systems does take real courage, and I think future generations will thank you for the work that you're doing today. I want to talk just 2 quick things. You've spoken extensively about the role of diet in preventing chronic disease, and I have 2 specific policies, bills that I'm working on that we've talked with the department about, but I'd love to get your public comments about them today. The first is food as medicine interventions, like produce prescriptions, medically tailored meals, which there's growing evidence that they can really improve outcomes for patients with chronic disease. So I think there's a role for these approaches in federal health programs. And of course, you know, CMMI is created specifically to test new healthcare delivery models that improve outcomes, lower costs. And I appreciate that under your leadership, CMMI has started to prioritize prevention-focused models. So I've been working on and plan to introduce actually this afternoon a bipartisan bill that would test a bundled payment that provides certain chronically ill patients with a comprehensive package, access to healthy produce, nutrition counseling, remote monitoring, with the goal of preventing disease progression and reducing avoidable healthcare costs. Just like to get your reaction to that, and love to have the continued support of the department for a policy like this.
I mean, we have the highest chronic disease burden in the world. Congressman was talking about the deaths from infectious disease, which are a couple of thousand a year. 90% of the people who die, the 3 million people who die in this country, die of chronic disease, and nobody's paying attention to this. And all of these members have ignored this for as long as they've been in office. This is the real threat to American health. In fact, during COVID, we had the highest death rate of any country in the world. And when you ask CDC, why is that true? They say, well, it's because we're the sickest population. The average American who died from COVID had 3.8 chronic disease. Well, what was killing them, COVID or the chronic disease? You have to understand chronic disease, infectious disease has a very hard time killing a healthy person. It kills people with chronic disease. And I'm looking forward to, you know, up to 70% of type 2 diabetes can be reversed, and people can even lose the diagnosis simply by changing their diet.
Yep. Well, thank you. I do want to bring up One additional piece of legislation that we're working on, food manufacturers are moving in the right direction due to your leadership on reducing additives, reformulated products, responding to consumer demand for healthier options. There's still a gap, though, in what's in the generally recognized as safe or GRAS pathway, where companies can self-determine a substance is safe. They determine that themselves, often relying on their own expert panels with limited transparency into potential conflicts of interest or underlying data. So that's another piece of legislation I'm working on. I think we should establish clear standards for self-GRAS panels, strengthen public confidence in our food supply. Just wanted to get your thoughts. Do you believe reforms like that are necessary?
That's absolutely critical. We have finalized in my agency a closing the GRAS loophole, and that regulation is now going through the interagency process. We're a little bit hobbled in what we can do, and Congress can do much more. So my office would love to work with your office on getting a much stronger bill, much stronger regulations. The GRAS loophole has been hijacked by the food industry. And because of that, we have 10,000 ingredients in our food. In Europe, they only have 400. And most of those have never been safety tested. We don't even have a list of them. We have no idea what they are. It essentially allows the industry to put in any chemical they want, any chemical they devise in lab, into our food without even the slightest regulations. And that needs to be changed if we're going to make America healthy again. I appreciate your help and your leadership, Congressman.
Thank you. Look forward to working with you on that.
Ms. Sewell.
Mr. Secretary, you've made a number of outlandish and frankly disturbing comments both before and during your tenure as Secretary of Health and Human Services. I want to draw your attention to one of those times. In a 2024 podcast interview, you suggested that Black children on ADHD medication should be reparented. You said every Black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented. There is a lot to unpack in that comment. I know that you've already answered several of the questions I was going to ask, and so I'm just going to rephrase them. Mr. Secretary, you've already admitted that you are not board-certified physician, and you've already admitted that you did not go to medical school. Have you ever reparented, or parented, I should say, a Black child?
I don't even know what that phrase means, and I doubt that I said it.
A yes or no answer.
I doubt that I said that phrase.
You
No,
absolutely
I'm not
said
going to answer something that I didn't say.
You absolutely said it.
I'd like to hear the recording.
So to be
Because
clear,
it doesn't make any sense.
I'm
I
gonna
don't even know
reclaim
what
my
it
time.
means.
I don't either. That's why I'm
And
asking.
by the way,
So to be
of
clear, you're not a
26
doctor, you have no medical degree, and you have no formal medical training.
as
And
have,
you have
as
never
have,
parented a
as
Black
have
child.
24
are
of the
suggesting
26
that
HHS
government-
secretaries
Mr.
have not
Secretary,
had medical
This is my
degrees.
time. And I say to the chairman, I want to reclaim my time. So you are not a doctor, have no formal medical training, and you've never parented a Black child, and yet you are suggesting that the federal government should take Black children away from their families and reparent them and send them off to some wellness farm instead of providing them with evidence-based
You're just
medical
making stuff up.
I am absolutely not making this up. Mr. Secretary, in your opinion, what factors should the federal government consider when reparenting a Black child who has been on ADHD or ADD?
I don't even know what you're talking about, Congressman. I don't know what you're talking about. I don't know what reparenting even means.
I don't either, but you said that.
I did not say
Mr.
that.
Secretary, for Black families in the United States, the issue of family separation is not new. Our nation has a long and painful history of separating Black children from their families. During slavery, Black children were taken from their parents and sold with no regard for their humanity. And after slavery, Black families continued to face forced separations through Jim Crow laws, discriminatory policing, and child welfare systems that too often assumed that Black parents were unfit. Even today, Black children are removed from their homes at higher rates than white children. not because of their greater harm, but because of longstanding bias and built-in institutionalism. For you to suggest that Black families are not capable of raising their own children is deeply offensive. Sir, you are the Secretary of Health and Human Services for the world's most powerful country, and your words matter. When you suggest that reparenting Black children, when you sow doubt about the safety of vaccines, and when you promote unproven statements that have no basis in science, you endanger the lives of everyone across this nation. Those children have parents, and to suggest that they have to be reparented is offensive.
I never
Secretary,
suggested that.
your words matter. When those words are careless, communities pay the price. When your words are imprecise, they create confusion. And when your words are dismissive, they cause real harm. So you don't have the pleasure, because of your position, to speak first and think later. Not in this job and not because of your responsibility.
I expect,
and the American people expect, that you choose your words with sincereness and with seriousness, the seriousness that your position demands. American lives are at stake, and it's time that you start acting like it, sir.
Thank you. Ms. Hearn. Mr. Hearn. Mr. Hearn.
Thank you, Mr. Chairman. It's good to be with you today. Mr. Secretary, thank you so much for, sorry. It's good to have you here today. I really appreciate it. I want to use my time to bring an issue to your attention. Last month, a young man from Oklahoma, Jacob Toe, came to meet me in my office. He told me a story that stuck with me and one that can make a huge difference for children in our country. In 2024, Jacob was in the midst of a custody dispute for his 3-year-old son, Leonardo, or Leo as they called him. One day, Jacob got the call no parent ever wanted to receive. While Leo was in his mother's care, the young boy passed away. Jacob learned that Leo died from an accidental ingestion of fentanyl that was left within the reach of his mother's home. Jacob fought to figure out how this could possibly happen. In doing so, he learned that the drug screening panels used in the child welfare process did not test for fentanyl, which is not detected by standard drug panels. While talking to lawmakers back home, they, like me, were shocked that fentanyl was not already included in the child welfare drug screenings. I believe other states across the country do not realize this gap in care and safety exists. While grieving the death of his son, Jacob decided to get involved. He told his story all around the state of Oklahoma, urging lawmakers to correct this deadly gap in testing and keeping kids safe. Thanks to Jacob's effort, last month the Oklahoma State House of Representatives passed Leo's Law in honor of young Leo. This bill requires the Oklahoma Department of Human Services to include fentanyl testing in all child welfare drug screenings where fentanyl use is suspected. This is not an issue that is unique to Oklahoma. Other states, such as California, have followed suit and introduced similar legislation. I'm proud of my home state for leading this charge, and even prouder of this young man from Kellyville, Oklahoma, who has turned his unthinkable tragedy into successful advocacy efforts. I commend Jacob, but I know he cannot do this alone. We must do our part and help him ensure that no other child is harmed from fentanyl like his son Leo was. Secretary Kennedy, 2 things. Will you work with Congress to educate states about this ongoing issue and hopefully get them to introduce laws, and figure out how we can work together at the federal level to ensure all states are testing for fentanyl and child welfare drug screenings when necessary?
I will work with your office on that. I think it's a wonderful objective. As you say, it's normally regulated by state law, but we can look at other options.
It would be great to get everybody to do this. I'm sure children are dying across the country. Like I said, even California saw the need to do this and pass their own laws. One other question before I go. Substance abuse is one of the leading factors for kids entering foster care, and in fiscal year 2024, more than 30% of children entered foster care due to substance abuse by their parents. Under your leadership, ACF has expanded access to drug treatment under the Title IV-E Child Welfare Program for parents as part of the Great American Recovery Initiative. What steps can Congress take to build on this administrative's emphasis on prevention services?
We've now funded as part of the Great American Recovery Plan as a STOMP program. We're working with states, with law enforcement, with detoxes, with rehabs, and sober housing to bring together a treatment that has been fragmented and atomized in the past. We also, one of the primary problems with drug treatment is it has the same perverse incentives as we see in the main, in the physical health medical system, which is that people get paid more by keeping the addict addicted. If you go to a rehab and you relapse, that's the best thing that'll happen to that rehab, because then you're coming back for a second bite. And we're now working on implementing a model, and I actually visited a place in Arizona called Camelback this week that guarantees where the rehab, after you go there for 30 days or 60 days, will guarantee if you relapse within the next 12 months, you come back for free. And that gives the rehab the incentive to make sure you're going through IOP, that you're getting drug tested, that you're getting psychiatric care, that you're going to 12-step meetings or whatever they need to do to maximize, because their financial incentives are now aligned with the incentive of getting you healthy. And I think ultimately that's where we need to move toward value-based care rather than essentially what's a fee-for-service model.
Right.
Thank you, Mr. Secretary. Mr. Chairman, I will not yield back time because I don't have any to yield back, just to point that out. Thank you.
Thank you, Mr. Hearn. Ms. Del Bene.
Thank you, Mr. Chairman. Mr. Secretary, I'm glad you're appearing before us today. Under your leadership, CMS recently added new layers of red tape that Medicare patients need to navigate to get the care that they're entitled to. Mr. Secretary, I hope you understand the harm that delaying and denying necessary care can have. Do you remember saying this, quote, "Americans shouldn't have to negotiate with their insurer to get the care they need. Pitting patients and their doctors against massive companies was not good for anyone," end quote. Do you remember?
I don't remember, but I would align with that.
And I'll submit for the record actually a press release from CMS with your quote in that from June 23rd of 2025.
Without objection.
In this case, I agree. Pitting patients and their doctors against massive companies isn't good for anyone. And yet, less than a week after you said that, CMS announced the WISER model. The program allows private companies to use AI to review traditional Medicare claims and pays them based on the amount of care they deny. This program went into place in 6 states across the country, including my home state of Washington. President Trump said multiple times on the campaign trail that he would not cut Medicare, but this program does exactly that. For example, Joanne is a senior from Washington on Medicare. She has a herniated disc that is pinching her sciatic nerve, causing immense pain down the right side of her body. Her doctor prescribed an injection that would help relieve her pain. If it had been prescribed last year, she would have received the treatment, no problem. But because of the WISER model that has been implemented, she's been in intense pain for over 6 weeks while she waits for approval. She has been using crutches or a wheelchair for over a month now, which is making her arthritis worse, adding to her chronic pain. Since using crutches, she's fallen multiple times, including earlier this week. Instead of simply approving the procedure, Joanne's conditions are getting worse. And Secretary Kennedy, the W in the WISER model stands for wasteful. Do you think that Joanne's treatment, which would allow her to walk and live with less pain that her doctor has prescribed, do you think that's wasteful?
Do you want me to actually answer that question?
Yeah.
I think that that's a terrible outcome. It's one that was not intended by the system, obviously. The problem is there's tremendous ways. In Medicaid, there's only 5% of the cases are given prior authorization. In private industry, 30%.
This is traditional Medicare now, where
Medicare.
it's now, this has only been put under prior authorization under your leadership. Now, President Trump promised multiple times that he, quote, will not lay a finger on Medicare. Given President Trump's promise, did you or the president approve this model, which is now delaying and denying care for people in states like the state of Washington.
And can I answer the question?
Yeah,
So
people are being denied care across our state
I'll
right
say
now.
very quickly. And this is an example. 5 years ago, we were paying $250,000 a year for $250 million for skin substitutes. This year, $23 billion. Why? Because there was no prior authorization in the Medicare program.
And now someone like Joanne is not
And
getting her
now-
care. It's more expensive for us because Joanne is not getting her care. We have story after story. I can also submit for the record stories of all the people who are being delayed and denied care. It is more expensive for us. It is more expensive for them when they are not getting the care they need. Last year, I sent CMS a letter detailing my concerns about the Weiser model. I still have not gotten a response. That was last August. Can you publicly commit to responding to that letter and addressing the concerns of this harmful model?
Yeah, absolutely, we will. And I apologize for not getting back to you sooner. We have an unprecedented number of communications from Congress.
Well,
We try to
we
give
don't have you
each
here
one of
very
them-
often. We have people in my state who are being denied care, who are being hurt based on this policy, and there's an indifference to the challenges that they are facing, all because of a model put in place for no reason and doing exactly what you said shouldn't happen, which is, and
As
I
I said-
quote, pitting patients and their doctors against massive companies. These are private companies doing this prior authorization. Was not good for anyone. Thank you.
As I
yield
said,
back, Mr. Chairman.
discovering $23 billion worth of fraud is not for no reason. And that,
You are hurting patients in our state and other states across the country for no reason, and I appreciate you finally responding to the letter. Thank you. I yield back.
Ms. Miller.
Thank you, Chairman Smith. Secretary Kennedy, thank you so much for coming in front of our committee today and for your leadership in improving the health and well-being of the American people. I have two things I'd like to discuss. In my home state of West Virginia, we see some of the highest rates of chronic disease in the country. Coupled with our rural nature and limited access to care, many of these patients are especially vulnerable and face significant barriers to managing their conditions. The first chronic disease that I want to speak about is our patient population that I am focusing on, which is people who are living with chronic kidney disease and the end-stage renal disease. I commend the administration's effort to promote affordability and fiscal responsibility in healthcare. I am concerned, however, that in the case of kidney disease, the current ESRD bundle may inadvertently discourage the development of adoption of new therapies and technologies that could improve outcomes and reduce long-term costs for patients who do rely on life-saving dialysis. The complicated post-TDAPA policy has resulted in promising innovative drugs being pulled from the market entirely or only being accessible by a tiny fraction of the patients. I have a bill called the Kidney Care Access Protection Act, and it is a piece of legislation that could expand access to the new treatment options in a way that both encourages innovation and ensures costs remain well managed for Medicare and taxpayers. As we work together toward better outcomes and cost containment, how is CMS evaluating ways to strengthen incentives for innovation within the ERSD bundle while still maintaining fiscal responsibility?
I mean, I would say that that's the balance that we're all trying to achieve. We are doing everything in our power to maintain the United States as the innovation center for the world, and we want to make it easier to get quick approvals for drugs that actually work. We need to do science on them, and we're doing gold standard science, and we have depoliticized science at the agencies. I don't know enough about the renal disease aspect in the bundle, but I'm happy to work with you. Also get somebody from Oz's team to come over and talk to you directly, because I know that that's not an outcome that they would like.
That would be wonderful. The second issue that I wanted to talk to you about is
that it is clear that what we eat plays a direct role in our health, and quite frankly, many Americans don't eat right. And these poor nutrition choices are a major driver of chronic disease. I believe there's a strong case of expanding access to MNT therapy for targeted and specific groups in Medicare beneficiaries whose outcome could actually measurably improve as a result. With that in mind, can you share your perspective on the role medical nutrition therapy should play in improving health outcomes for Medicare beneficiaries, and how we can most effectively and responsibly expand to those who would benefit from the most, particularly in the rural and underserved areas?
Yeah, I think, and I've worked with Governor Morrissey about that on this issue, and I think there's nobody at this agency who is not committed to the idea that food is medicine, that it is, and if we want to do prevention in this country, we've got to, and end the chronic disease epidemic, we've got to start with food. That's one of the reasons we're pushing nutrition into the colleges, we're pushing it into the hospitals, we're pushing it into the community health centers, to make it the central focus of healing and prevention. I want to work with you in any way that I can to achieve the goals that you're talking about.
Thank you so much. I yield back.
Dr. Murphy. I don't think your mic is working.
Oh, nope. Use this one.
All right. Is it now? It's working now. Thank you for coming. I want my 12 seconds back. Thank you for coming. You know, we're talking about a little bit about vaccination. I think we ought to talk a little bit about the arrogance of a fellow named Anthony Fauci, who came and lied to Congress, lied to the American people, and in my opinion, destroyed the confidence of the American public in the healthcare system. So I think that when we're talking about vaccination, that's number one. Number two is your predecessor, who was not a physician either, led the greatest invasion in this country of 13 to 20 million illegal people coming in this country who were not vaccinated and brought in disease into this country. So let's actually bring facts into that conversation. Second of all, I share some of the concern now about what's happening with our drug delivery system going to China. They are developing a burgeoning industry that is threatening what we do as primal confidence, at least in the American pharmaceutical industry, and I think we really, really have to be concerned about that. I think the greatest thing that your administration has done is bring highlighting to the fact that food is medicine. I saw a child in my clinic about 6 weeks ago that was 8 years old that weighed 262 pounds. This is what we're dealing with. This is what the obesity epidemic, and it is sad that the number one drug that is selling now in the country are weight loss drugs. This is endemic. This speaks to the terrible, terrible tragedy that has become the American food industry. So thank you for highlighting that. I want to get back to one thing that is my passion, and that is the cost of care in this country. The cost of care in this country has risen tremendously, in my opinion, primarily because of vertical integration that has happened in this country, primarily which has been caused by the ACA. That is the number one driver of healthcare costs. We can talk about the pharmaceutical industry, we can talk about the other things. But we, a few weeks ago, had the arrogance and the vanity of our health insurance industries come in front of this committee and just sit to point fingers otherwise. You convened last summer, in July, the 70% of those who insured in this country, and they said they were going to do better. And I know they gave a report saying they've cut down prior authorizations by 11%, but frankly, after 35 years in the healthcare industry, I don't believe a damn word that they say. And until we get the middlemen under control in this country, the number one driver of healthcare costs in the pharmaceutical space is not the pharmaceutical industry, it is the pharmacy benefit managers, it is the middlemen. And until we get rid of this thing that is only present in the United States, we will not drive down healthcare costs. And so I urge you to be the hallmark of your administration is to go after what we have created, is the vertical integration that is destroying the doctor-patient relationship and bankrupting America. Second of all, I want to talk about the No Surprises Act. To your point, absolutely, a great bipartisan, bicameral bill. Your predecessor, of course, went straight and gave all the authority to the insurance companies. I have a bill, HR 4710, which puts meaningful enforcement back into this. Right now, our vain and arrogant insurance companies are keeping hundreds of millions of dollars just in their little kitty, which has been appropriated to people who provided the care, but they're keeping it. And so enforcement mechanism, and I understand your administration is working on that, so I thank you with this. And then lastly, excuse me, I applaud the Trump RX. We had Mark Cuban come in. We're working with the administration and trying to do this with Cost Plus. I saw a patient, again, about 6 weeks ago. He changed insurance companies. The pill he had been on for 15 plus years was now close to $1,500. I literally pulled out my phone and went to Cost Plus, and it was $15. So I applaud the administration for getting the middlemen out. These are the problems that the American public is facing. You know, we can talk about all the other extraneous issues, but if people can't afford health care, that's not access to health care. And when you allow 20 million people in the country and you overload hospitals and you overload of healthcare systems, we can't provide care to the American public. That is our primal and first duty. So I want to say thank you for what you're doing. You have a tough job. We're here to support you, and thank you for your efforts. With that, I'll yield back.
Ms. Chu.
Secretary Kennedy, we have a child care affordability crisis in this country. Working families are having to pay skyrocketing prices, in some cases as much as 40% of their income. And too many working parents are having to leave the workforce or turn down job opportunities because they can't afford child care. This is hurting American families, our workforce, and our economy. During your 2024 presidential campaign, you did a commendable thing. You proposed that the federal government should subsidize 100% of child care costs for families below the poverty line and cap expenses at 10% of income for all other families. It's right here in this article from the National Catholic Register. And yet, just 2 weeks ago, President Trump said, "We can't take care of child care. We're fighting wars. We can't take care of daycare." Now, earlier you were asked about this and whether you agree with it, and you actually didn't answer it. You said, "Well, I fully funded Head Start," but your agency is illegally withholding child care funding from every single state unless they submit a bunch of extra data not required by law. And also, the president's budget request for 2027 proposes eliminating $350 million for preschool development grants. Do you agree with eliminating $315 million from preschool development grants?
Those funds are going out, they're not being withheld. You're mistaken about that.
No, this proposal, actually what I said was the elimination of $315 million for preschool development grants. I'm just wondering, because it's completely contradictory to what your presidential campaign was. Well, anyway, let me say this. Child care is one of the top expenses for American families and is becoming increasingly unaffordable. President Trump campaigned on the promise that he would lower costs, but his record while in office has been the exact opposite. He keeps on withholding federal funding for child care. His reckless tariffs have raised prices on food and everyday goods. Gas prices are also up thanks to his unpopular war of choice in Iran. So remember, Mr. Secretary, you once said for the cost of the Ukraine war, we could make child care affordable for every family. It's ironic that Trump is doing the exact opposite, not funding child care because we have wars to fund. It's a slap in the face to every American. And now I'd like to switch to another topic, hepatitis B. Today, I'm thinking about my friend, Chi Moy, who was a city council member in my district, San Gabriel, California. Chi did not know that he had hepatitis B until he donated blood. Eventually, there was a liver tumor that spread to his pelvic bone. He was on the city council by then, and we watched as he grew weaker and weaker, and then he became the first Asian American mayor. But he died of liver cancer just 1 month after his installation, and we think he hung on long enough to reach that milestone, only to die at the age of 53. It was beyond tragic, but to think his life could have been saved had he been vaccinated from hepatitis B as a newborn. Secretary, you've done an incredibly harmful thing to our community. You eliminated the mandatory hepatitis B vaccine for newborns, and it disproportionately threatens Asian Americans because while we make up 7% of the population, we account for 60% of all hepatitis B cases. It's clear that this administration has no regard for the health, safety, and well-being of Asian American communities, as well as communities across the United States.
You want me to reply?
Well, if that's...
Hepatitis
Do it
B
quickly, yes.
is a terrible disease. But babies are not at risk unless they essentially have zero risk, unless their mother is infected. For all mothers are tested when they go into the hospital to have a baby, and for all those people who are infected, the vaccine is still a recommended vaccine. For everybody else, it's available. Parents can assess the risks themselves through informed consent. Insurance will pay for it. We did not remove the vaccine from being insured. And we just believe that Americans should have that choice, that the state should not make that choice for them. Hepatitis B vaccine was not safety tested. It had a 4-day test with no placebo. We don't know what the risk profile is, and parents are allowed to ask that question.
Mr.
The
Costello.
science is that it's not simply about choice, it's about whether infants are protected during the most vulnerable period.
Infants are protected. Those
Okay,
at risk are
Mr. Kustoff
protected.
is recognized.
Thank you, Chairman Smith, and thank you, Secretary Kennedy, for appearing today. If I could, Secretary Kennedy, I represent parts of Memphis, Jackson, Tennessee. You and I have talked about Jackson, Tennessee before, and rural West Tennessee. I wanted to talk to you about hospitals, particularly in those rural communities. I know that because of the CMS Area Wage Index, we have hospitals that are in primarily rural areas that are being paid less than those in urban areas. During the president's first term, CMS did introduce the low wage index hospital policy, and that did help to reduce that discrepancy. Back on March 26th, a few weeks ago, I introduced with Congresswoman Terry Sewell a bill called the Save Struggling Hospitals Act. So it is bipartisan legislation. It aims to keep rural hospitals open by codifying an adjustment to the area wage index to ensure that hospitals in rural and low-wage areas receive a fair Medicare reimbursement for the essential services that they provide. I know that you've publicly said before that you support codification of the low-wage index hospital policy. I guess I just wanted to ask you, that is something that you still support and you would support being codified?
Absolutely. I wish that we could fix it within the agency, but as you know, the Social Security Act requires that any adjustment has to be revenue neutral. And that means if you take from one area, you have to give to another. If you give to one area, you have to reduce payments to the other. It's a broken system. It needs to be fixed, but only Congress can fix it. And I and my agency will work with you toward that goal.
Thank you, Mr. Secretary. If I could ask you about peptides. A lot of attention with peptides. We know that about 3 years ago, the FDA removed 19 peptides from the list that compounding pharmacies could routinely make, and that limited access. Can I get your general opinion on peptides and your agency, your department's plans, if there are any, for maybe mainstreaming peptides?
Well, we returned 12 of those peptides yesterday. The class to the Category 1 category so that formulators will now be able to formulate them. Peptides are like supplements. The FDA is only FDA has authority to require pre-licensing safety studies, pre-marketing safety studies in any drug that claims a specific indication and that's mass marketed. If you don't make those claims, if you're not mass marketed, then FDA does not require that. So like supplements are not regulated in that way by FDA. Peptides are not supposed to be regulated. It's been upheld again and again by the courts. The Biden administration improperly moved them to Category 3 without any evidence of safety. The only justification they have is if there's a safety concern, and there was no science that indicated a safety concern, so it was improper. We have now remediated that by moving them back.
Thank you very much, Mr. Secretary. Now yield back, Mr. Chairman. Thank you, Mr. Fitzpatrick.
Secretary Kennedy, in a long overdue move, the FDA is finally taking steps to remove petroleum-based food dyes, including red 40, yellow 5, yellow 6, blue 1, blue 2, and green 3 from our food and our medicine starting immediately. These dyes have been unequivocally linked to cancer, to hyperactivity, and to so many other serious health risks, and yet they have been left unchecked and unlabeled for absurdly too long. Secretary Kennedy, beyond commitments from industry and beyond regulation from the FDA, what steps can this legislative body take to make sure that we preserve over the long term cleaner ingredients in our food and our medicine as we look to address the link between these chemicals and the chronic disease epidemic?
The most important thing that you could do, Congressman, is to close the grass loophole. We have regulations now that do everything in our power, my agency's power, to close that loophole, and those are now in the interagency process, so we've completed it within my agency. There are now other agencies of equities in them and are looking at them, but it doesn't go far enough, and we need to go farther. We need to really make sure that any ingredient in our food is safety tested first. That's what they do in Europe. That's what they do in other nations. That's why they only have 400 ingredients in their food in Europe compared to 10,000 here. And so that we would love to work with you on that legislation. I think it's absolutely critical if we're going to make America healthy again.
Second, I want to address something that is of critical importance to my constituents in Bucks and Montgomery counties in Pennsylvania, pertaining to the chronic disease epidemic, pertaining to the impacts of PFAS and microplastics in our food and our water supply. There is more that can be done at the federal level to address chemicals and toxins in our food and water and elevate how these issues are connected to deteriorating health across our nation. Specifically, the recent joint announcement that HHS and the EPA will be including microplastics in the EPA's contaminant candidate list and launch the ARPA-H program to detect and remove plastics from the human body, I believe to be a positive development in addressing the intersection of toxins in our food and water and the chronic disease epidemic. Secretary Kennedy, could you expand on the agency's efforts to further address microplastics and PFAS contaminants in our food and water supply, and how these actions will impact overall health and fighting the chronic disease epidemic?
We're putting $140 million into the STOMP program at ARPA-H to track, right now, the average American has a teaspoonful of microplastics in his brain. Almost 1% of brain volume is now microplastics. That couldn't be a good thing. We know very little about the pathways by which it goes into the brain. There are hundreds of components in microplastics, hundreds of different kinds. Some of them may be benign. Other ones we know are hideously toxic. We are going to identify those. We're going to trace the pathways so that we can better regulate them. The other thing that we're doing is moving them to the MCL, to the maximum contaminant list in the Safe Drinking Water Act, so that we can now start regulating, establish maximum contaminant levels for both PFAS and microplastics, and start regulating them effectively in drinking water. I want to add this, that the amount in our brains has doubled over the past 5 years. So this is rising exponentially, and it is an existential crisis.
Thank you, sir. I yield back, Mr. Chairman.
Thank you. Ms. Moore. Ranking Member Moore.
Thank you so much, Secretary Kennedy. And I just want to join in with the committee and sort of, remembering the Kennedy family. I remember being 9 years old, begging my Republican mother to vote for John Kennedy. I don't think he won in Wisconsin, but I do think that your family has made a great impact on this country. I promise to give you easy, comfortable questions if you don't yell at me and hurt my feelings and overtalk. I promise you. I just want to thank you for pointing out stuff like the dyes and stuff in food, and maybe even the looking at the food pyramid. I think that that's been a very helpful discussion in terms of your making America healthy again. And I'm just going to ask you a question, and I hope it's sort of outside of the scope of your service. But how does the the $1.4 billion cut in WIC and the $900 billion cut in SNAP interfere with your Make America Healthy initiative? I know that departments are told they have to cut. Do you think that that will interfere?
Well, am I happy about the cuts? No, I'm not happy about the cuts.
Don't you think it will? I mean, Fruit Loops are a lot cheaper than good, healthy food.
Yeah, nobody wants to make the cuts. Russ Vought doesn't want to make the cuts. President Trump doesn't, but we got a $39 trillion debt, and that's costing every American child $6,600 a year.
Yeah, I get that, sir.
Oh,
okay, so it is my time. Thank you.
All right, thanks.
And I am, I'm focusing on children here. You made a beautiful quote that I was not aware of in your testimony. You said, although children may be the victims of fate, they will not be the victims of our neglect. You claim your uncle said that. What uncle were you talking about? John F. Kennedy Jr.?
President Kennedy.
President Kennedy. Although I just thought it was just classic. And so I just, when we start putting things on the chopping block and cutting stuff, I would have hoped that we would not have started with our children. And I just want to know how that statement, that attribution to President Kennedy fits in with, cutting completely Healthy Start, which is a proven program that has decreased infant and maternal mortality. I don't get it. It just contradicts that whole notion of not neglecting our children or firing 20,000 people in your department with consolidations that give technical support and help develop state plans around TANF, the Social Service Block Grant. These are the most vulnerable people and kids. I mean, even cutting $43 million out of the free diaper care sort of program. And I'm just making a statement. I'm not asking a question, not confronting you, but I took all these notes while you were talking to other people, so I just had to kind of address them. I am wondering how your Make America Healthy Again program fits in with the National Database for New Hires. It's a federal database maintained by your office for the purposes of assisting child support agencies. Very sensitive information, and Section 453 says that you will only use the data. How does giving that data to ICE support your mission at HHS?
Well, all the things that we do in terms of data sharing comply with the law.
No, this doesn't comply with the law, specifically Section 453. I would love to see the General Counsel's memo on this, if you wouldn't mind submitting that, because
I'm happy to submit it.
Please, and let the record reflect that he will give us that letter, because it is definitely in contravention of our laws. I want to thank you for your indulgence and thank you for appearing here.
Well, thank you for the respect and the kindness of your presentation.
Thank you, sir.
Mr. Stubbe.
Thank you, Mr. Chairman. Mr. Secretary, the contrast between the Trump administration and the last administration cannot be more striking. On issue after issue, when your predecessor came before this committee, he was defiant and claimed ignorance. In March 2024, I questioned then HHS Secretary Becerra about the Office of Refugee Resettlement's process for finding placements and shelter for unaccompanied migrant children. Of the more than 100 questions submitted by this committee, my question to him about missing children was one of only 2 questions that your predecessor declined to answer. The Biden administration's open border policies were nothing short of a lethal disaster for our country. Let's be clear about the facts. The Biden DOJ received thousands of allegations of sexual abuse related to unaccompanied minors processed through ORR. Under the Biden administration, ORR permitted individuals with criminal records, no citizenship, and who refused a background check received custody of unaccompanied children. Over the course of 10 months alone, the agency lost contact with nearly 20,000 unaccompanied children. Under the Biden ORR, case managers failed to perform home studies on more than 95% of placements of unaccompanied children. And finally, grand jury testimony in my home state of Florida revealed unaccompanied children were placed in the custody of convicted felons in homes with multiple unknown male occupants. This is unacceptable. Becerra's refusal to even acknowledge the issue when I brought it up to him is disqualifying. That is why I introduced the Stop Gaps Act with Senator Moody that builds up upon the Trump administration's success on securing the border by requiring the ORR to work with state and local authorities to guarantee safe and proper vetting of all individuals and entities before granting them custody of an unaccompanied child. Under the Trump administration, the border is secure, crimes from illegals are being stopped, and there are rigorous standards in place to better protect children. Mr. Secretary, can you speak to the work that your agency is doing to combat our social services being taken advantage of by bad actors and the increased safety of our children?
Yeah, I mean, it was a humanitarian crisis, what my predecessor engineered with the Biden administration. They lost 425,000 children. They lost them because they ended verification of sponsors. People were just showing up with fake IDs. There was no genetic testing. There was no income inquiries. There was no ID validation. And we are now in the process of trying to find those children. We've been able to locate 138,000 of them. And they're very, very difficult to find. Many of them, as you say, have been trafficked. They've undergone slavery, sexual abuse. We found one sponsor who picked up 42 children, and their address was an empty container in a parking lot. And there was no effort. And in fact, the administration, Mr. Becerra, specifically ordered people in my agency to end the verification process. They were more interested. They explained that the objective was to move kids out of custody as quickly as possible. Well, they made a lot of mistakes, but now, thanks to President Trump, the amount of unaccompanied minors has dropped by 97%. We have beds now for 7,600 unaccompanied minors, and only 2,000 of those are filled. We hold them until we can completely verify the people who pick them up are actually family members, and that has never happened during the last 4 years.
Well, thank you for your service to our children and to the unaccompanied minors and the changes that you have made from the previous administration. I yield back.
Ms. Tinney.
Thank you, Mr. Secretary. Really appreciate your service and your great responses today. I just wanted to commend you first for your very sensible position on vaccines. I too am a fan of the greatest tennis player in the world, Novak Djokovic. I see you got to play tennis with him. When Javier Becerra,
I lost, by the way.
Yeah, not surprised. Who can? When Javier Becerra was here, I asked him, I was trying to get a waiver for Mr. Djokovic to be able to play in the U.S. Open at the time, the #1 tennis player in the world, and still I would argue the greatest ever. And he described to me that they would not give him a waiver for because he did not take the vaccine because it was science, although a lot of other American tennis players were allowed to be there who were not vaccinated. So thank you for your common sense approach to choice and pro-safety as opposed to being anti-vaccine. I'm glad you clarified that today. But I wanted to jump to a really important issue in my district, and especially in the state of New York. During the COVID crisis in upstate New York, nursing home residents were isolated from their families for months, sometimes years, and Governor Cuomo disgracefully called it protecting them. But the reality is that people declined rapidly in isolation and in most cases died without a loved one present. That wasn't protection, it was a policy failure of enormous consequence by Governor Cuomo and his administration that cost lives to thousands of seniors, not to mention the deadly nursing home order that he required nursing homes to take COVID-positive patients where they didn't have the ability to handle these patients. Sadly, many of those same bureaucrats responsible for carrying out this disastrous policy are still working in Governor Hochul's administration. That's why I, along with my co-sponsor, Representative Larson, Fitzpatrick, Panetta on this committee, and numerous others, have reintroduced what's called the Essential Caregivers Act, a bipartisan bicameral legislation that guarantees nursing home and long-term care residents the right to in-person access to a designated family caregiver, even during a public emergency. It also directs CMS to establish clear, uniform safety protocols so visits can continue safely. Families and friends are visitors. They are loving caregivers, and they advocate, they catch things maybe that a nurse or staff would not, and cutting them out of the facilities didn't protect the seniors, it actually accelerated their decline. I was wondering, because of this situation and the isolation of so many nursing home residents, which contributed to serious physical and cognitive decline, independent of the virus, by the way, given the department's guidance and generous access for designated caregivers in nursing homes, do you share the view that maintaining family access during emergencies is a patient safety issue and not just a quality of life issue?
Absolutely, and we made a lot of mistakes with the countermeasures during the COVID pandemic, including shutting down the schools, shutting down businesses. Those things kill people, and that's one of the reasons, in my opinion, that we had the highest death rate of any nation in the world. We lost 3,000 Americans to COVID for every million population. There were other countries, Haiti, for example, had 14 per million population. So Nigeria, 14 per million population. We had 200 times the death rate of other countries. We had 10 times the death rate of Europe. And a lot of it was just because of bad policies that were not science-based, and we are not going to do that under my watch. And one of the reasons that I think blacks were much more likely, most likely to die, was because depriving them of access to a family member, their hospitals and their neighbors already closed, depriving them of access to a family member meant that there was a reduced incentive within the hospital to provide them with the kind of good care that they needed.
My time has expired, but can I just ask you, would HHS support codifying a federal right for essential caregivers and giving them access?
I personally would support that. My agency will work with your staff.
Thank you. We appreciate it. Thanks so much for your testimony. I yield back.
Mr. Boyle.
Thank you, Mr. Secretary. I'm over here. Thank you. I'm hoping this can be constructive and have a conversation with you. I have the honor of representing an incredibly brave constituent and proud fellow Philadelphian, LaTanya Morrison. Her grandson, Ahmaud Butler, tragically died of a rare form of brain cancer at just 6 years old. Last year, she and her family marched 179 miles on foot from Philadelphia to Washington, D.C., to bring attention to the critical need for childhood cancer research funding. I met her right outside here on the Capitol steps and had a wonderful but also heartbreaking conversation with her, and have been working with her and her family since then. Specifically working with her on a proposal called the Ahmaud Butler Childhood Cancer Hope for a Cure Act, to make sure that no grandparent, parent, or loved one has to go through what she and her family experienced and continue to experience this day. That hole in her heart will never go away. So my concern is, and I have no doubt that you have concern for this constituent I just described and all those who particularly have lost a child to this horrible form of cancer. But at the same time, your administration, or you as secretary in this administration, are carrying out hundreds of millions of dollars in cuts to cancer research funding. So I was wondering if you could explain why you're doing that, and does that really get us anywhere closer to getting a cure that we all want to cure this horrible disease?
First of all, thank you for sharing that heartbreaking story. And, you know, the worst thing that can happen to a human being is to lose a child or a grandchild. And it's something that I hope that I never have to experience. And my heart goes out to that family. The one agency that within my agency, and the only agency within NIH that actually got a budget boost from our proposal, was NCI. And we, you know, we're absolutely committed to cancer research, and particularly pediatric cancer research. I invite you, Congressman, to call me to tell me if there are programs. Some of our programs were duplicative, so we've moved them around, and it looks like there was a cut, but I don't know of any major cancer studies that have been cut. I'm happy to talk to you about it. You reach out to me.
If you could, after this, sorry, just because you know we're time limited and I have under a minute now. So I appreciate that, and if our staffs could follow up, or you and I directly with one another after this, and I would just ask if I could get your pledge, not for me, but for my constituent, if I could get your pledge that you will work with me, my staff, the White House, to get the president to declare childhood cancer a national emergency, which would, as you know, help unleash additional resources and really focus the attention that we need on childhood cancer.
Yeah, in theory, I like the idea. Let's talk about the details. You know, we've already done, the president already signed an executive order on pediatric cancers. I was there at the time. So I need the devil's in the details, but in theory, I absolutely support that proposal, and I'm happy to work with you and your staff on it.
Thank you, and I yield 0 time back.
Mr. Chairman, I seek recognition to ask unanimous consent to enter into the record the exact transcript of Secretary Kennedy's remarks that we discussed regarding the reparenting of Black children.
Without objection.
Thank you.
Ms. Fishbach is recognized.
Thank you, Mr. Chair. And Secretary Kennedy, I'm over here. I know it gets confusing. There's lots of us and we're running around a lot. And I just want to tell you, thank you so much for being here and thank you so much for your willingness to answer questions. It always amazes me that people even agree to come to these committees because we have you sit there on the hot seat for hours on end. We all get to run around, get coffee, whatever it is, and the witness is sitting there. So I genuinely appreciate that you're here and that you're answering questions very honestly and frankly.
My staff did not tell me that I had a choice.
Okay, well then, fair enough.
I am happy to be here.
Well, thank you very much. And just so you know, I'm from Minnesota. I represent a rural district, and I think you know rural Americans face heightened healthcare challenges. While nationally, healthcare is seeing increasing staffing costs, staffing shortages, and increasing wait times. All of these problems are amplified in rural areas where care is already more limited. And I know that we counteracted that with the Rural Health Transformation Program in the Working Families Tax Cut Bill last year. And significant funding was to strengthen the healthcare in small towns across the country. I know in my office and in other Minnesotan offices, we sent letters of support to CMS in favor of the application and the funding, but the Rural Healthcare Transformation Program alone is not enough to solve those rural healthcare issues. And so I am wondering if you could just talk a little bit about what's the administration's plan to reduce health disparities in rural areas, and what specific actions are you taking to ensure quality and affordable rural health care remains a priority within HHS?
I mean, we've already finalized rules for site neutrality. I think that will help. The administration would love to work with Congress on the wage area index, which I think also will help. And then, you know, we are continuing, we made the biggest investment ever in history on rural health care. We're continuing to make additional investments. I mentioned I think, $135 million that I allocated for community health centers last week. And so this is a priority for the president. It's a personal priority for me. And, you know, if you have ideas of other things we ought to be doing, we'd like to hear them.
Well, and Mr. Secretary, I appreciate that because it is such a critical part of, and like I said, representing a rural area, healthcare, having the access to that healthcare. And I know that Mr. Estes had talked a little bit about specialty care in rural areas, but it is absolutely critical for the survival of our small towns and the health of our individuals who live there, that we have healthcare available. And I think some of our provisions for telehealth and things like that have really moved things forward. But your offer and we have worked with the department, and so I appreciate that. And I'm actually going to yield back 35 seconds.
Thank you. Mr. Moore.
I'll take that 35 seconds if I can.
I didn't give it to you.
Yeah, I understand. Sir, the most important thing you said today in Congress, that Congress has allowed $39 trillion of debt, and so that's forced you and your agency and your amazing team, some of which I know are very debt-focused, Mr. Andres, you had to tighten your belt. I just want to say, as an American and as a member of the Bipartisan Fiscal Forum, I can't thank you enough for doing your part, doing the hard part, to be able to find redundancies. You'll get criticized for it, but it matters, and every agency needs to be doing it. So thank you for that. I've mentioned to you in private how much I appreciate the administration's focus on autism. You may recall my 10-year-old Winnie is neurodivergent on the autism spectrum. He's the joy of my life. But that's tenfold for my wife and for his younger, older, and twin brothers. And I want to just highlight that I'd never had a ton of expectation on what we could uncover from scanning the pre-existing research. And look, I've always appreciated the administration's focus on this, though. But I was underwhelmed with what we ultimately put out. My wife was hurt, and she felt for a split second until she came to her senses, and we talked about this, that there was any way she was responsible. We don't even know if she took Tylenol during her pregnancy, but that was a hurtful moment for her. And I just want to encourage the administration and your team to keep at it. And I think there's more we can do here. With low expectations, I don't expect much to be able to figure out what the ultimate causes are. That's not an easy thing to do, but I do think there's more that we can do, and we can build past what I was ultimately underwhelmed with. So again, thank you for the administration's focus, and I think we can do more. Regarding something that's very important legislatively, I introduced HR 5343, the Ensuring Patient Access to Critical Breakthroughs Product Act, which builds on one of the biggest wins from the Trump administration. We didn't fully get it implemented, but the MSIT was a significant policy for Medicare coverage for breakthrough medical devices. This bill requires CMS to provide temporary medical coverage for treatments or devices that receive breakthrough designation from the FDA. If a treatment can meet the FDA's burden of proof of safe and effective and other requirements for breakthrough designation, there's no reason Medicare shouldn't be able to provide temporary medical coverage while CMS completes its review for permanent coverage. And this is a brainchild of the Trump's first administration. We've talked about this. We all agree in principle about this. It's difficult to move in some cases, but can you update this committee on your efforts to implement a policy like this through any type of executive rulemaking?
I think, are we in rulemaking? We will have an announcement soon, and we're happy to work with you on it.
This is really important and builds on the success from the Trump first administration. There is, as I'm learning too, the FDA and CMS, they operate in parallel, they operate in tandem, and sometimes there's different regulatory constraints that they're going with. we've got to be able to work through those. And if that's all this ultimately is just a difference between those two structures, I mean, this is a good policy that will help improve people's lives, and it will keep safe and effective technology it'll enhance safe and effective technology and get that into the healthcare system.
Yeah, and I agree with you, and particularly if it's a temporary payment that can be revoked, that is intended to be temporary. It's not permanent, as you know. It's with a lot of medical devices, we find problems with them later.
We had tons of bipartisan support on this committee. Some that even didn't support it last time are now on board. It's a great initiative, and I look forward to working more with you. Thank you.
You too.
Mr. Byer.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to yield such time as he may require to the ranking member, Mr. Neal.
Thank you, Mr. Byer. Mr. Chairman, I want to make this moment an opportunity to correct the record on the No Surprises Act, which was passed out of this committee with bipartisan support. I wrote that legislation. I know what was in it. And every Republican on this committee at the time sided with me, and we passed it out of the committee unanimously and had a big victory on the House floor. Like any new program, it needs some help for sure, but the notion that the suggestion we heard from the Secretary that somehow that it languished under Biden is simply not true. The national issue here before us, it's still the regulations that were implemented. It created new protections against surprise medical bills for 200 million Americans. Millions of families benefited from what we've done here every single year. This is a victory that Democrats and Republicans on this committee should take credit for, and I yield my time back to Mr. Byer.
Thank you very much, Ranking Member. Mr. Secretary, the Agency for Healthcare and Research and Quality, AHRQ, has been given an essential task by Congress. It's the only federal agency specifically dedicated to improving healthcare delivery for Americans. It was actually a Ronald Reagan creation. Making people's experience with healthcare easier and ensuring that taxpayer dollars are spent on effective, affordable, and safe care. But, Mr. Secretary, your department's budget justification included $106 million in cuts to AHRQ. The White House budget request was $129 million in cuts. The budget appendix listed $116 million in cuts. The budget also lists more than 250 staff at AHRQ, but widely available reports fewer that 100 people remain at the agency. Mr. Secretary, these discrepancies read either as deliberate misrepresentation or basic accounting errors. Can you clarify how many millions of dollars you intend to take away from research designed to give Americans access to the best, most affordable health care?
Thank you for that question, Congressman. Dr. Klein, who is running it, who is a Yale-educated physician, who is running AHRQ, still has hundreds of staff, and the agency is operating.
Thank you. Well, let me shift to the United States facing a mental health crisis. As you know, nearly a quarter of U.S. adults had a mental illness in the last year, reported 30% of high school students. You recently led an agency reorganization. There was a big scare in January where $2 billion was cut from SAMHSA for substance abuse and prevention and mental health. There was a bipartisan outcry and it was restored. But there's also this real concern that there's a gutting of SAMHSA. I co-chair bipartisan the House Mental Health Caucus. We'd love to have a bipartisan briefing on the reorganization. We requested that back in December, and I'd love for you to commit to a briefing for members in Congress of the bipartisan Mental Health Caucus on the current status of the mental health programs at SAMHSA, CDC, and NIMH.
I strongly support SAMHSA. It's a private mental health, and particularly addiction are priorities for me, strong personal interests, but also their national catastrophes. There were termination letters that went out under SAMHSA. That was a mistake. We immediately recalled them within 24 hours, and I'm committed to continuing operations in SAMHSA. I'm happy to meet with you about it.
Thank you very much, Mr. Secretary. Mr. Chairman, I yield back.
Ms. Van Dyne.
How are you doing today?
I'm great.
I appreciate you being here. And I know a lot of questions have been asked, and some of the accusations have been just outrageous. I have a bunch of stuff I wanted to ask you about, but clarify. Your qualifications have been called into question because you did not father a black child. How many different HHS secretaries have had that privilege?
I've had a
It's a ridiculous question, isn't it? You know the answer? 0. Do you know how many Democrat-appointed HHS secretaries have had a medical degree?
I think there may have been, of the 26.
Nope.
There
0.
may-
0. Not a 1.
in history.
Yeah, not a 1.
I think there may have been 2 with medical degrees.
Yeah, there's a lot going on that your office is handling and doing so well, and we're so proud of. You know, we had, and I'm looking for this photo, we had a previous secretary who I asked questions about what was going on with the waste, fraud, and abuse. And I don't know if you recognize this. I asked Secretary Becerra the same question. What's going on at 14545 Friar Street in Van Nuys, California? Does that ring a bell to you at all?
No, I could guess. Why don't you tell me?
We had over 100 different licenses for hospice.
For hospices?
Yep, right at this address. And we asked him what he was doing about it. Basically, nothing. Can you walk through what your office is actually doing on the waste, fraud, and abuse to make sure that we don't
We've
see this
already
happening
shut
again?
down 500 hospices in Los Angeles. And incidentally, we haven't had one call from Congress or anybody else about complaining, because clearly these were fraudulent. A lot of these places, like you'd say, they'd have, they were just invented addresses. They would obtain patient identification, or they would pay people. They were going and giving people in poor neighborhoods flat screen televisions, $600, and then they would enlist them enroll them in the hospice, and we were paying them $6,000. And the interesting thing is, almost none of them ever died. Typically, they stay in a hospice about 18 days. These people stayed forever. Nothing ever happened because they weren't actually there. They were just invented. And it was operated by certain foreign communities, a lot of Estonians and a lot of Armenians, and there's an incredibly great Armenian community in Los Angeles, and very few of them were involved in this, but the ones that were making hundreds of millions of dollars out of fraud and just stealing money from us. I think the cost has been about $5 billion.
And it's ridiculous. And I don't think a week goes by where your office is not uncovering further fraud. And what we're finding in California is now they're going after the people who are uncovering the fraud. They're actually trying to make it illegal for some of these journalists to even do their job and uncover it. They're not upset about the fraud. They're upset that it's being uncovered, and your office is helping to do that. I had a ton of questions I wanted to ask you about affordability. You know how expensive health care is. Not health insurance, but health care. There's a big difference. But like on association health plans, what's your thoughts on that? And I know not everything is going to be within your purview, but what are your thoughts on making more competition in the marketplace?
That's what we need. We need outcome-based care. We need more HSAs. President Trump wants to take the money away from the insurance company. And so Obamacare was passed in the years after Obamacare was passed, the share price of the insurance companies, the share value went up 1,000%. It's still up 300% compared to about 150% for the S&P 500. And so they are making money hand over fist. And the American people who were supposed to benefit, their premiums have not gone down. They had the illusion that they went down slightly. President Trump is actually taking steps that will drive the premiums down and give better quality care to Americans. And
I appreciate that very much. I yield back.
Thank you. Now the chair recognizes Mr. Arrington for 4 minutes.
Thank you, Mr. Chairman. Mr. Secretary, good to see you. Thank you for your leadership and your service to our country. We have the best system and the worst system. I mean, the best docs and mid-levels, the best facilities and technology, and yet we have the worst, most inefficient system relative to the rest of the developed world. When you get to the cost and quality intersection, and it drives me crazy. I think at the heart of that, for me personally, it's market dysfunctions and distortions, right? I think transparency, choice, competition. That's the best way to deliver value for taxpayers and for patients. And taxpayers and patients aren't getting their best bang for the buck here. And it's bankrupting the country, and it's putting people, families, working families, further and further from access to good care for their families and the people that they love. So the current incentive structure is distortionary, and it inhibits these forces, creating sort of monopoly dynamics, anti-competitive behavior. So I spend most of my time thinking about healthcare reform with respect to that framing. Some examples. In the world of drug innovation, there's patent abuse where biotech companies are extending the life of their patent without making novel contributions, using patent thickets, and essentially having these exclusive rights extended and gouging all of us, and we're allowing it to happen. I mean, I'm quite frankly not putting the incumbents, market participants at fault. It's the perverse incentives that we've allowed to persist. One simple one for me is this disparity between what we pay hospitals and physician groups for the same outpatient service. And the effects of that are not just higher premiums on seniors in Medicare, higher costs for all of us as taxpayers, but there's a giant sucking sound of independent physician groups and docs into hospital systems, leaving us with less choice. So those are just top-of-mind examples. You are a breath of fresh air. We may have disagreements on how to attack some of these problems, but you have a rare curiosity and objectivity and independence that you bring to this leadership, this incredibly important leadership post for our country. And I think the problem with all these distortions is that we have too much special interest, too much incumbent resistance, too much parochial politics, and everyone in this town seems to be captured by it to some extent, or to one extent or another. You just seem to have been able to, through the fiery furnace of public scrutiny over the years, I don't know what it is, but I love that you can come to this. I believe with all my heart that you just want to do the right thing for the country and for all participants, and for especially our patients. Give me, in the last 25 seconds, your best shot on the monopoly forces and anti-competitive behavior. What are one or two things that you think this body could do to address that and go a long way to make things more affordable for working people in this country?
Thank you very much for those very, very kind and undeserved words. 10 years or 15 years ago, 80% of the doctors in our country were independent, and 20% were corporate. Today, 20% are independent, 80% are corporate, and the number that are independent are dropping precipitously because of the economic forces that are a result of these perverse incentives. Site neutrality, which we're fixing, is key to that. The wage area index, reforming the PBMs, that is one of the most anti-competitive forces out there, and we're doing that. You've given me legislation which I'm now looking forward to implementing through the regulatory process. And then we need the FTC to file some cases, and it's already doing that in the PBM space. So those are just a few of the things that we ought to be doing, and thank you for raising all those important issues.
God bless you. Thank you.
Thank you. Remind members that votes have already been called, but we're going to try to work as deep as we can into the hearing while votes are going on. So now I recognize Mr. Panetta from California for 4 minutes.
Thank you. Thank you, Mr. Chairman. Thank you, Mr. Secretary. Thank you to your staff for being here. As we've heard today, there unfortunately are a number of issues that I believe are causing people to get a little exhausted because they are scared of your agenda and with your leadership. An agenda that is threatening to the health and safety of our nation, and the lack of leadership that has led to 2 major vacancies in your department. At the CDC, Dr. Menares was fired after only 28 days, reportedly for not going along with your anti-vaccine agenda. But since then, August of last year, the CDC has been without either a director or even an acting director. Now, I know you have Jay Bhattacharya overseeing the CDC, but he's also overseeing NIH, managing over 27,000 employees and two campuses that sit hundreds of miles apart. Furthermore, at CDC, DOJ slashed whole offices, resulting in almost 20% of its staff either being fired or quitting, and there's even been hiring freezes there as well. For most of the past year, you've had people close to you act as proxies, and in some cases, you've even taken unilateral actions, like you did last May when you rolled back COVID-19 vaccine guidance for pregnant women. Additionally, people should be aware that now that after passing the 210-day statutory limit for temporary leadership at CDC, Bhattacharya can no longer legally perform the full range of director duties. That means that without an acting permanent chief, tasks that congressional statutes explicitly reserve for the CDC director can only be performed by you, the HHS Secretary. That includes policy decisions like adopting vaccine recommendations for the CDC's Immunization Advisory Committee. The Surgeon General's post is also vacant. Now, I know that Casey Means, a MAHA devotee with no active medical license and not a practicing physician, had her confirmation hearing 2 months ago. But she performed so poorly, including her unwillingness to commit to recommending vaccines, that the Senate has not scheduled a vote. That fact, and the fact that there's 1,500 cases of measles that have occurred this year throughout the nation, the fact that a recent E. coli outbreak has sickened people, it seems that the Senate is having a hard time with your agenda. I know that the literal holdups of these positions are from the Senate, but it's clear that you and the Senate are having a hard time agreeing on people. The issue is, Mr. Secretary, that without leadership at DHS, if there is a crisis, if there is an outbreak, we lose surveillance. There's delayed recognition of problems, there's low response times, there's mixed messaging, and a loss of real-time guidance. These vacancies hurt America's health, and they make Americans less safe. There's some disagreement with you in the White House as well. You've heard of glyphosate, the herbicide, correct, Mr. Secretary?
Yes.
And you called it one of the likely culprits in America's chronic disease epidemic, yet the president ignored your advice, and he signed an executive order that bolstered the production of that weed killer. We all know what happens when it comes to your vaccine policy, but according to a recent YouGov poll, nearly 3/4 of Americans believe that vaccines are somewhat safe or very safe. And now the courts seem to be getting tired of your agenda. In March of this year, a federal court paused some new vaccine policies from HHS, including reducing the number of jabs recommended for children, and reconstituted a vaccine advisory committee. Mr. Secretary, your stance on vaccines and the vacancies in the public health leadership coincide with a continuing decline of public trust in federal health authorities, something that's only gotten worse with the current administration. We need credible voices when it comes to the health and safety of our nation. We need a CDC director that we can trust. We need a Surgeon General that we can trust, because right now, Mr. Secretary, many, many people in my district and all across the country are having a hard time trusting your agenda. I yield back.
Mr. Feenstra.
Thank you, Mr. Chair and Ranking Member Neal. Thank you, Mr. Secretary, for taking the time to be here today. Greatly appreciate it. Last year, we Republicans passed a working family tax cuts bill, the largest tax cut in American history. And working alongside with your department, we included $50 billion in rural healthcare transformation programming to create high quality and affordable healthcare for rural communities. I'm so proud of our state, Iowa, that's one of the 4 front runners and leaders in advanced care and delivering some of this dollars to our farmers, our families, and our seniors. One of the biggest problems we're having in rural America, rural Iowa, and I'm the leading voice on this, is the diminishing access to maternal health care. We have women traveling 50 to 75 miles or more for maternal care. And I understand historically low patient volumes make it feasibly burdensome for small rural hospitals to provide delivery services. But currently, less than half of our rural hospitals in the U.S. have labor and delivery services, and they continue to recede every year. Maintaining access to maternal health care is incredibly important and vital for rural communities. Can you expand on what we can do and how I can work with your department to change the tide in this area?
Well, first of all, thank you for raising that issue. President Trump is absolutely committed, more than any president we've ever seen, in preserving rural health care. It's in crisis right now. As I pointed out earlier, we've lost 120 hospitals since 2010. And his investment in the Rural Health Transformation Fund, which you voted for and approved, is the biggest investment in history in rural health care. And it's a 5-year investment. It increased the influx of federal dollars into rural health care by about 50% every year for the next 5 years. We're also doing other things in my agency to funnel additional dollars to rural health care, and that includes the $135 million that I approved last week for community development health centers, which are primary in rural areas.
So with that, we also have a shortage of specialty doctors, whether it be OBGYNs, whether it be oncologists and stuff like that. Again, come from a rural state of Iowa. Is there anything that we can do to try to keep these specialty care doctors and even family docs in rural America? I mean, it just seems like they're all gravitating to the urban centers, and we're having a hard time recruiting family doctors, oncologists, OBGYNs. Anything that you can offer, any suggestions that you can offer to help rural America, rural Iowa in that area?
Well, we've just finalized and promulgated the site neutrality rule, which should help.
Yeah.
The biggest thing that needs to be done is fixing the wage area index. And that's something that has to come from Congress.
Yep.
We'd love to work with you on that.
Yeah. Well, thank you. I appreciate all your department is doing. And Secretary, thank you so much for being here, and I yield back.
Thank you.
Ms. Smelly-Takis.
Thank you, Mr. Secretary. I want to begin by thanking you for your leadership on an issue that is very important to me and so many Americans, and that is ending the inhumane and outdated animal testing in this country. Hundreds of thousands of dogs, cats, monkeys, rabbits, and other animals remain in captivity for painful and unnecessary procedures, even though studies have shown that animal testing in medicine frequently fails to accurately predict human conditions. We are seeing real progress by this administration. The NIH is investing $87 million in a new center to develop standardized lab-grown 3D tissue models, and has announced that grant funding may be used to support finding homes for retired lab animals. And you've also asked agencies to prioritize non-animal methods, and you've also ordered a review to end the importation of monkeys from Asia for testing. I just want to urge you to stay the course. I'm very happy to work with you to continue to make progress here to end this cruel, costly, and antiquated practice. I also want to thank you and the President for working with our New York delegation to fully fund and staff the World Trade Center 9/11 healthcare program. My district is home to many first responders, and unfortunately, sadly, they're still suffering from 9/11 related illnesses, so I appreciate your efforts. Also, Secretary Kennedy, as you know, 1 in 5 adult Americans are currently living with mental health condition, including over 3.2 million New Yorkers. Timely and convenient access to mental health professionals is essential for individuals to receive the care that they need. We must do more to integrate mental health services in primary care settings, and that is why I've introduced the Complete Care Act, which incentivizes primary care providers to integrate mental health specialists such as psychiatrists, psychologists, and substance abuse counseling into their practices and provide a temporary increase in reimbursement to help cover the costs. So my question is that a piece of legislation, I know this is a priority for you in the administration, is that a piece of legislation that you could potentially support?
Yeah, and we will work with your office on that. And on animal testing, there's $25 million to NIH in the proposed budget that we've proposed to, again, find other alternatives to animal testing. We're already doing a lot of work on organoids, on tissue chips, on AI, which actually are more accurate and faster and cheaper than animal testing. So it's part of our larger effort to speed drug approval.
Well, thank you very much. And again, I lend my support to you and however I can help with those efforts. One last issue I do want to bring up is women's health. Recently, the HHS hosted its first ever national conference on women's health. It's an important step in elevating the conversation around women's health care access and research that has been chronically underfunded in both the private and the public sector for decades. My question is, how does the administration plan to advance its goals of improving health outcomes for women, particularly in underserved areas that have historically faced limited investment and resource constraints?
But, you know, part of that for rural areas, the Rural Health Transformation Program hopefully will expand those abilities to treat maternal health. We are putting enormous investments into maternal health, and I could go through those with you in detail. But we're spending literally hundreds of millions of dollars on it. We've got multiple programs. And I just would mention again our perinatal pilot program, which has reduced, it has 220 hospitals that are involved. We provide them protocols reducing maternal mortalities. And we have succeeded in those hospitals in reducing maternal mortalities by 41%.
Well, I appreciate that, and I don't have a rural area. I do represent New York City, Staten Island, and Brooklyn, but we do have a lot of safety net facilities, and we'd love for your administration's attention to that as well. Thank you so much.
Thank you.
Thank you, Mr. Snyder.
Thank you. Mr. Secretary, do you know who Alexander Fleming is? He invented penicillin. How about Gerhard Domach? I guess you're not going to answer. He invented sulfonamide drugs. How about Salman Waxman? Still nothing. Okay. Well, he invented streptomycin, drugs that we use on tuberculosis. Would you agree that these three people help make people healthier, the medicines they discovered?
I would say yes.
All right, thank you. What's interesting is all
Did you say thalidomide? Did you say thalidomide?
I did not. I said streptomycin.
Okay.
So European, all of them were born in Europe. Now, Salman Waxman moved to the United States in 1910. He actually left Ukraine because of anti-Semitism, same time my grandmother did. What unites them is all three won the Nobel Prize. Salman Waxman won it as an American citizen. Fleming was Scottish, Domach was German. UK has 29 Nobel Prizes in medicine and physiology. Germany has 16. The United States has 93. But if you expand it beyond just medicine, and now I'm going to focus on the National Institutes of Health. From the National Institutes of Health website, they've identified 174 scientists who have either worked at NIH or done research funded by NIH that have earned them a sole or shared part of 104 Nobel Prizes. NIH has led the world in scientific research, leading to extraordinary breakthroughs, changing the lives, not just American lives, but lives around the world for the better, making Americans healthier and people around the world healthier. NIH is the crown jewel of American research. Mr. Secretary, are you familiar with SMA?
SMS?
SMA. SMA is spinal muscular atrophy.
Yeah.
So it is a disease, it's a progressive rare genetic disease that affects the motor neuron cells of the spinal cord. Children with SMA don't walk, they can't sit up. If they're not treated, 90% will die before the age of 2. Are you familiar with gene therapies?
Of course.
Okay, well, gene therapies, do you think it's worth exploring the possibilities for gene therapies like we did in other things at NIH?
We are doing that aggressively. We're putting tens of millions of dollars into it, and we are accelerating approval of
I appreciate that, because SMA, which is a death sentence for children age 2, now has a treatment developed in my district with research support from NIH, now a drug called Zolgensma, that instead of dying at 2 with this gene therapy, these children are achieving the milestones parents want for their children of sitting up, feeding themselves, even walking. We believe it is a cure that these children will now, instead of dying at the age of 2, live out their full lives. And this is the development that is happening because of research at places around the world, in this country, all supported by NIH. And we're here today to discuss a budget that you brought before Congress where you're proposing to shrink NIH funding, the world's premier funder of medical research, shrink it by $5.7 billion The CBO predicts that this reduction could lead to 50 fewer drugs coming to the market over the next 30 years. Drugs that can cure diseases, save lives, make America healthier again, and you're cutting that funding. You're diminishing science. You're making it harder for Americans to lead. I picked those three people, Fleming, Domach, and Waxman, because at the turn of the last century, scientists from around the world came to the United States because they were chased out of their countries in Europe. The actions you in this administration are taking are chasing American scientists away from this country and fueling the research and development and drug commercialization in places like China. You are not making Americans healthier. You're making Americans sicker, hurting our economy, and making our children's future less prosperous, less secure. You should be ashamed of yourself. I yield back.
As votes have been called, the committee will stand in recess until immediately following the vote series.